Our strategy for women's, children's, and adolescent health 2016-2030 is guiding collective action by governments, partners, and stakeholders to address gaps that are contributing to high maternal, newborn, and child mortality in the region. So far, 24 countries have developed strategic plans defining their priority interventions. And in the area of immunization, the most effective public health intervention that we have for saving lives. For example, 41 countries have gone through the polio switch successfully, have introduced inactivated polio vaccine into their routine immunization programs. 38 are now using pneumococcal conjugate vaccines, and 33 are using rotavirus vaccine in their routine immunization services. We conducted a recent evaluation in 15 countries, which reinforced the findings on the efficacy of routine rotavirus vaccination of children under 5 years of age. In this study, an estimated 135,000 hospitalizations and 21,000 deaths were prevented through routine use of rotavirus vaccine. We have published, as WHO, an African regional report on nutrition to provide information on the current situation of nutrition in relation to the global 2025 nutrition targets. And this report highlights several challenges, which include, of course, malnutrition, which is still highly prevalent, with the majority of our countries having stunting prevalence, which is above 30% of children under 5. At the same time, we have obesity and overweight increasingly manifesting in childhood in our populations. And we recognize that we have gaps in data. We still need to support countries to working with our partners to have better data on nutrition that will enable the kind of interventions that are needed. Much of the data that we have available in most countries is more than 5 years old. So this is a call for us to focus more on providing this evidence that will enable all of us, particularly governments, to take the appropriate action. Next, please. As far as health system strengthening is concerned, as I indicated earlier in my statement, we have worked to develop a framework on health system strengthening towards universal health coverage in the region, working very much with officials from the countries and with partners in a series of steps that we've undertaken over the last 2 years. We launched this framework for realigning health systems at last year's regional committee, and we thank you for having endorsed that document. We now look forward to working with you to put in place the strategies that are part of the menu of options contained in this framework. We've undertaken visits to countries to review with you what is the status of health system strengthening and to identify what are the key steps that are needed, taking into account the context of each country to improve the situation, to scale up access to services with a strong drive on equity in our countries. And we have been very encouraged by the enthusiasm to adopt a structured, defined approach to progressing towards UHC in the countries. And we'd like to urge our member states that have not been visited yet to look at the framework. We are asking our representatives to work with you even before you receive these missions to see how you can benefit working with partners and accelerate progress towards universal health coverage. We have helped countries to continue to collect data on financing for health through national health accounts, which is very important for monitoring what resources are allocated to health, domestic resources, as well as international support, and helping us work with you towards fairer financing decisions with an eye on equity, as well as monitoring progress on financial health protection to prevent households falling into poverty because they need to pay directly to access health services in countries. And we supported 25 countries during this period to produce national health accounts. Several of our member states are already working repeatedly over the years, every couple of years, to produce national health accounts, which enables them to see the trend then in financing for health and in some of the key indicators of fair financing for health. Namibia, Mozambique, and Nigeria, for example, as well as Tanzania, have gone further and established national health workforce accounts, which enable them to monitor the evolution of the situation of human resources in the countries, which can be used for planning, for implementing, and for seeing how countries are both generating training as well as retaining and distributing human resources in order to provide health services in a scaled-up manner throughout the territories. Access to affordable quality medicines is fundamental to universal health coverage, we know. And we are working with the small island development states, particularly Cabo Verde, Comoros, Mauritius, and Sao Tome and Principe, as well as the Seychelles, to develop a pooled procurement strategy to enable them, taking into account the small volume of drugs that they have to procure, to have access to more affordable, available medicines, particularly starting with non-communicable diseases, which are a big problem in these countries. And we hope soon to have concrete results coming out of this strategy, in which we have to very much thank our small island development states, ministers, and countries for being determined to overcome this problem. And in addition, several countries have developed national essential medicines lists for procurement and use of drugs. As far as improving quality is concerned, 5 countries are implementing action plans on substandard and falsified medical products in line with the regional strategy on the regulation of medical products in the African region. We have been very encouraged by the political commitment shown by several heads of state, and I will cite some and ask the pardon of those ministers whose presidents are also taking action here. But we've seen the presidents of the Republic of the Congo, the president of Benin, and several others take very concrete measures to ensure that the circulation of falsified and substandard medicines is limited in the countries. And I'd just like to indicate that in this respect, during the UN General Assembly, we will be organizing a side event on this matter where we hope to exchange experiences between countries, because it's something that requires not only your action as ministers of health, but also partnership with other ministries that play an extremely important role in limiting the importation into your countries of poor quality drugs. Next slide, please. A word about polio. First, to recognize the fact that it's 2 years since the last wild polio virus transmission was documented in the African region. So we think that this deserves, as I said earlier, a cautious celebration. I think personally that it deserves recognition. While we do acknowledge that we have challenges as far as surveillance is concerned in areas of insecurity in some of the countries that are concerned, especially in Nigeria. So I would like to commend the Honorable Minister of Nigeria and his team for this achievement, for this milestone, while we recognize that we are continuing to have to work hard with our polio partners to build on this and to make sure that we are steadily moving towards documentation of eradication in the region. The African Regional Certification Commission for Polio Eradication has continued to exercise its mandate of critically reviewing certification documents, and so far 40 countries in the region have had their polio-free documentation accepted. So with sustained progress, our region could be certified to have eradicated polio by the end of 2019, but this requires additional efforts, including in those countries that have not had polio cases for a very long time. We need to sustain the level of surveillance, we need to sustain the quality of surveillance, and we'd just like to assure you of our commitment together with our polio partners to work with countries that are dealing with polio in several ways. We have unfortunately had outbreaks of circulating vaccine-derived poliovirus type 2, and in fact during the lunch break have just had a meeting with the Honorable Minister of the Democratic Republic of the Congo, who unfortunately could not join us for this meeting because that country, as well as some countries in East Africa, Kenya, for example, and Nigeria also have circulating vaccine-derived poliovirus type 2. We recognize that the time that we have to respond effectively to this is limited because the vaccine is becoming more and more ineffective. We have synchronized campaigns planned in the Horn of Africa to start on the 14th of September, and we have also worked with the DRC, as I've said, to support the minister and his team who are going to be implementing also some campaigns starting at the end of this month. I'm very pleased to say that the work that our member states have done on polio has taught us many lessons. One of the things that we are learning is how to operate in insecure circumstances, how to work with communities, how to engage those who are involved in some of the conflicts in such a way that we push access to communities, to populations, to be able to deliver services and to work to make sure that people who are living under these circumstances also have access to immunization services as well as other health services. We've used very much GIS technology to track what is going on in delivering such campaigns, and we believe that this is a tool that can be expanded to doing many things in our health services delivery, to track delivery, to do supervision, to monitor quite exactly what is being done and compare that with some of the reports that we are seeing. So we encouraged very much this adoption of this technology and the exchange of experiences among our member states who unfortunately are having to work in the context of insecurity to see how we can push the boundaries and continue to be able to provide services together. Next slide. As far as the work on health emergencies, meaning outbreaks, humanitarian crises, is concerned, the current 2017-2018 outbreaks of Ebola virus disease in the DRC have proved to be a litmus test of our new health emergencies program in WHO. But despite the unique challenges of both these outbreaks, the response was swift, thanks primarily and very importantly to the leadership, the openness of the government, and also to the support of the partners who came together, worked with us and others to provide technical support, material support, financial support, very importantly, to the governments. And again, we'd like to commend the government of the DRC for demonstrating this leadership and thank all the other governments in our countries who are more and more working on outbreaks in line with the international health regulations, the speed with which you declare outbreaks, the work that you are doing to coordinate the response of partners, the establishment of emergency operating centers, which we anticipate will turn into public health institutes that are able to oversee both the work on preparedness and also coordinate response to outbreaks as they occur in countries. We are extremely encouraged by the efforts that you are making. And as I said earlier on, we thank you for having evaluated your preparedness and are ready to work with you to mobilize the resources needed now to cover the gaps that you have encountered in these evaluations. So to conclude, we just say that there are several areas in which we also would like to thank our member states for the solidarity that you have shown by offering your experts to join us, to join other partners when we have to respond to such severe outbreaks as the Ebola outbreak in the DRC. As far as, next please. What have we done as far as corporate services and enabling functions are concerned? In fact, when we started our work on the transformation agenda, we led with these management aspects of our work and have seen that they have started to bear fruit. As I said earlier, we also invested very much in partnerships, and we observe that we are managing to both expand our partnerships. I'm very happy to welcome for the first time some of the participants in our regional committee that exemplify this expansion of our partnerships. We have here from some of the Gulf countries, some notables whom we have reached out to support the work that we are doing within the region, within the context of their existing partnership with WHO at the global level. We also recently signed a new cooperation agreement with the International Telecommunications Union as an example, and see this as a unique opportunity to help our member states to leverage the latest technology for all aspects of the work on public health in countries. We've reached out to young people in the region, and I'm very happy to report that we've reached out to young entrepreneurs, some of the clever people in countries who are able, with sometimes very difficult circumstances, to put in place a plan to start a business and to succeed. And they are advising us on how to mobilize resources and partnerships in our region. We believe that our investment in building strong partnership over the past few years has resulted in a better quality of relationship with our partners, where we not only are looking for funding, but we are also looking for common agendas and how to work together better in order to support member states. I'd like to cite in particular our continuing collaboration with the African Union Commission and the work that we are doing both with the social sectors, the Commissioner for Social Affairs, and particularly with the newly established Africa CDC in order to support the work that you are doing in countries. Next slide. To improve our operations, we have put a lot of emphasis on our accountability, on our compliance and risk management in the region. And we've invested in a robust results framework with both programmatic and managerial key performance indicators that we are using to track how we are improving to perform at each and every budget center, as we call them, each and every country office, as well as the regional office. We have found that our managers are very focused when they are looking at their performance compared to others. So if we show that your neighbors are doing better, your neighbors are improving at a faster rate than you are doing, we found our managers, WHO representatives, directors, quite focused on this and working to improve the way that they are managing the programs and managing the resources that you entrust to us to do our work. We have invested a lot in training of our staff in order to be able to be more focused on results and focused on delivering, including on managing our internal effectiveness better. And we are seeing that this acknowledgement that it is correct, it's proper, it is important to invest in the skills and competence of our staff is starting to bear fruit. Some examples that I'd like to share with you, for example, is that we've reduced to zero the number of unsatisfactory internal audit reports in the region. We have, as I reported last year, I think, developed a handbook on doing business with WHO, which I hope to have your confirmation that our representatives have presented to you, have briefed you upon, and which is being used as a tool to make sure that our collective responsibility, member states and secretariat, to manage our programs responsibly, focused on results, dealing with the resources the way that we should, are starting to bear some results. I'd like to, in this context, congratulate all the member states which no longer have outstanding reporting on the funding that we advance for you. In the past, this used to be one of the most painful subjects in Geneva at the World Health Assembly as far as our management in the African region is concerned. And we are very happy, and we thank you for your cooperation to say that this is no longer the case. And the countries that I'd like to name here are Benin, Cape Verde, Côte d'Ivoire, the Gambia, Lesotho, Liberia, Sao Tome and Principe, the Seychelles, South Africa, Tanzania, and Zimbabwe. So thank you for making sure that you don't owe any reports to the Secretariat. And I thank all the other ministers for the efforts that you are making so that we continue to show our donors that we are jointly managing the resources that they entrust to us in the way that they should be managed. We've also improved our procurement processes and have managed to start seeing some savings in this context. And I think ministers are aware of the degree to which, at the level of the governing bodies, but particularly at the global level, you are asking us to show value for money and to show the savings. Going forward, next slide, please. As I said earlier, we have evaluated the transformation agenda and launched the second phase, which is going to take us forward. We have been extremely happy to see how well it is aligned with the general program of work and the transformation that Dr. Tedros is proposing at the global level. And we are going to be working to see how we make our contribution to the $3 billion. We'll intensify our support to countries to advance universal health coverage, because we truly believe that if we use this as a framework, it will deliver for the different disease programs and for the different population subgroups for whom we have to be sure we scale up interventions both for prevention, promotion, and treatment. It is also strongly linked to the resilience that we'd like to reach as far as health security is concerned, and being able to prevent or contain outbreaks and respond to humanitarian crises. We, in addition, because of the uniqueness of our region, are going to be addressing specific issues such as the priorities that you have outlined, and in subsequent sessions we are going to be presenting to you what are the priorities that you would like to work on with WHO in the African region. And we'll continue, of course, on our work of strengthening compliance, improving the working environment for our staff members so that each and every one of them is inspired to give of their best, even as we demand delivery and accountability from all of us, including the senior management in the region. Next slide, please. Oh, I think we've come to the end. So I'd like to finish by thanking you again, honorable ministers and our member states, for the support that you are providing to us in the work that you are doing, in the changes that we are making, and for the commitment that you are expressing and showing to improve the health of populations. We do recognize that our challenges are many, but with the partners that are gathered in this room and those who have not been able to join us here, I'm quite confident that we will accelerate our progress towards UHC, and we will be able to reach the targets of the Sustainable Development Goals in health in the ways that your heads of state have committed. I thank you very much.
Je vous remercie, Dr. Moiti.
Thank you very much, Dr. Moiti. Ladies and gentlemen, dear delegates, now, previous decisions taken by the Executive Council, according to which WHO is asking for the organs to guide it, give it more guidance. Therefore, please make your inputs regarding any guidance in respect of the document presented. Now, for a more rational use of the time remaining in this session, I am sure I can count on you to be as concise as possible. I have already conveyed your congratulations to Madame the Director, so please use the time more profitably in a more concise manner. I'll give the floor now to delegates for their comments on the presentation made by the Regional Director. Any comments?
La Tanzanie.
Tanzania, you have the floor.
It's the WHO Regional Secretariat for the Comprehensive Annual Report for the period July 2017 to June 2018, which is very informative. We further welcome the improved capacity of WHO and member states to detect and rapidly respond to epidemics in the region, which are multiple in nature and require well-functioning health system with effective surveillance system. In view of this, we take note with appreciation on the establishment of the rapidly capacity to respond to epidemics and a well-functioning health system with effective surveillance system. In view of this, we take note with appreciation of the establishment of incident management system, which is activated for graded public health events within 24 to 48 hours. This assures that these issues will be addressed quickly by all relevant stakeholders before getting out of control. We also take note that 36 countries have done joint external evaluation so far, and they have detailed information on gaps related to the implementation of the International Health Regulation 2005. We recommend that WHO continue to assist countries to address those gaps by supporting the plan implementation and resource mobilization for additional financial support besides domestic funding. We appreciate the continued support in building resilient health system, including promotion of universal health coverage, but also human resources, enhancing access to affordable, safe and quality medicines, among others, so that we effectively combat communicable and non-communicable diseases which affect a high population portion of our people in the region. While the region is experiencing increasing use of advanced technologies, including the use of vaccines to address various health issues, we noted there is need to invest more on other public health interventions, such as promotion, the use of safe water and sanitation, nutrition, health education, and promotion. This will require stronger multisectoral collaboration, and we call on the WHO to continue to be engaged in these areas. Lastly, on issues of efficiency and accountability, we commend the Regional Secretariat for the ongoing improvements in strengthening reporting and internal controls, among others. There has been a substantial reduction of 60% in overdue reports on direct financial cooperation, which is a big achievement, as it was one of the challenges we had in the past, and we assume that the framework that is now in place on accountability and assurance will assist the region to reach the target of having no overdue reports on the direct financial cooperation. This achievement promotes confidence of using existing country systems, and it demonstrates that governments have reliable systems with which to receive resources from stakeholders, use them effectively, and provide timely accounts. We encourage WHO to continue using government systems instead of establishing parallel systems of support which are not sustainable and are not helpful in improving existing country systems. We take note of Regional Director's report. Thank you.
Thank you very much. Zambia, then Madagascar, please stand by.
Zambia is honored to take the floor and comment on the Regional Director's report on the work of WHO in the Africa region. Madam Regional Director, your work on the transformation agenda has led to the strengthening of WHO country offices, and we appreciate the consultative process with member states that occurred prior to these reforms. Zambia has continued to benefit from policies adopted from WHO through the life course, that is in maternal, newborn, child and adolescent health, and in the area of nutrition. Policies such as Treat All for people living with HIV to start antiretroviral therapy, coupled with political will from the country's president, Mr. Edgar Chagwa Lungu, for us to attain epidemic control of HIV in the country by 2025, have started bearing fruit, as reflected in the significant increase in the number of people who have been reached with health services. Chairperson, our country's geographical position, as well as other factors, man-made and otherwise, make her vulnerable to health emergencies and outbreaks, both from within and from across our borders. We attest to the assistance the country received through the Health Emergencies Program during the latest cholera outbreak, which lasted for almost 7 months. I wish to take this opportunity to thank WHO at various levels and other partners for the technical and financial support that we received then and continue to receive in our quest to control and eliminate cholera. WHO's work in the areas of surveillance, epidemic preparedness, and system strengthening have helped prevent some potential outbreaks from diseases that have been problematic in some of our neighboring countries. We urge the regional director and her staff, as well as the WHO Secretariat in its entirety, to continue supporting member states, particularly the most vulnerable. Continue using your position to advocate for reduction in prices of medical innovations that still elude some of our countries, but are key to the attainment of universal health coverage, as well as those that have the potential to significantly help reduce the burden of disease in our region. We take note of the report. I thank you.
Je vous remercie.
Thank you very much. I'll give the floor to Madagascar and Kenya. Stand by, please.
President.
Thank you, Mr. Chairman, Madam Regional Director, Excellencies, ladies and gentlemen, honorable ministers, distinguished participants. First of all, our warm congratulations to all present and Mr. Chairman. I'd like to thank the Regional Director for this report. Efforts made over the past few years by WHO Afro to support African countries in implementing their strategies have been very decisive because they help us promote health and fight better against diseases in our countries. In the past 2 years, Madagascar has faced a number of challenges, including maintaining our achievements since 2014 in our fight against polio, which has enabled us to be declared polio-free. And pulmonary fever appeared in some countries, and epidemiological surveillance has helped a lot, and we at every turn along the way have had the support of WHO experts who have been very professional in affording us their support. And the Ministry of Public Health and technical and financial partners were able to coordinate the work that needed to be done, and it is thanks to that that we were able to find solutions. And Madam Director, you visited our country with the Director General, and you expressed your support and you congratulated our country for succeeding in our actions, and you shared your rich experience in fighting against diseases in general and epidemics in general, and also in health management systems. Therefore, we are very happy. The government of Madagascar, through the Ministry of Public Health, and on my own behalf, I'd like to express our sincere thanks and deepest gratitude. We are confident that with our partnership, we will be able to improve our health system, and I'd like to ask you to be certain that you can continue to count on us on our collaborative effort in order to achieve what we want in terms of universal health coverage, in order to have better results, better contribute to the health and well-being of our populations and the development in Africa and Madagascar in particular. Thank you very much for your kind attention. Thank you. I'll give the floor to Kenya, and Burundi, please stand by.
Thank you, Mr. Chairman. Kenya is pleased to participate in this 68th Regional Committee and would like to thank the Republic of Senegal for their warm hospitality and the impeccable coordination in hosting this meeting. With regards to the Agenda 5 on the work of WHO in the African region. We wish to commend the Secretariat for the comprehensive report, which highlights WHO's contribution to the significant results achieved under the 6 categories of work of the 12th General Program of Work. The government of Kenya is committed to ensure that Kenyans have access to the health services that they need, that are of high quality, without suffering financial hardship. And as such, through the stewardship of the Ministry of Health, we have developed a roadmap for universal health coverage that will guide the implementation of UHC in this country. In this regard, I wish to convey the appreciation of the government of Kenya to the Director General and to the Regional Director, as well as the WHO Kenya Country Office, for the support they have given Kenya towards moving towards universal health coverage. We appreciate that as soon as His Excellency the President issued a directive to implement universal health coverage in November 2017, the Director General quickly triggered an entire response from WHO to support Kenya towards this initiative, and we are pleased to report to you that we have since then developed a roadmap for universal health coverage and health financing strategy, and we are now finalizing a revised benefits package to ensure that the health financing architecture is sustainable and responsive to the needs of all segments of our population. Ladies and gentlemen, this year, as announced earlier, Kenya became the 41st country to be declared guinea worm free, and we'd like again to acknowledge and appreciate the support of WHO in that momentous role of moving towards elimination. And we shall continue to ensure that we step up our post-certification surveillance to enable prompt detection and management of any new cases. We also like to urge WHO and its partners to continue supporting elimination of other priority initiatives. In Kenya, we are keen to eliminate trachoma and other neglected tropical diseases, and we welcome the support of WHO and partners in this regard. We'd also like to thank WHO, the regional director, for the expedient response to the Ebola virus disease in the DRC, and we'd also appreciate the expanded response provided to neighboring countries of Burundi, Rwanda, Uganda, and South Sudan in order to control the epidemic, and Kenya appreciates this effort in this regard. And then finally, we'd like to just say that as we embark on implementing the 3 billion targets, we would like to assure the Secretariat and the region of Kenya's continued support to ensure that our people are healthy and productive as we continue to reap the demographic dividend for even greater prosperity. We take note of the report. Thank you.
Je vous remercie. Nous donnons
Thank you very much. You'll give the floor to Burundi and Uganda. Please stand by. Thank you, Mr. Chairman, for giving me the floor. First of all, I'd like to congratulate the regional director for this report and also for her leadership in leading the transformation program, which has led to the achievements she has presented. Let me now ask WHO Afro to see how best to support member states in implementing specific programs regarding hepatitis, viral hepatitis, especially in terms of these communicable diseases efforts. Now, our programs in our countries, non-communicable diseases, for example, cervical cancer, some of these programs also cover sexually transmitted diseases, but people tend to focus more on HIV and forget hepatitis, whereas we know that prevalence of hepatitis is quite high currently. I'd like to avail myself of the opportunity to ask WHO Afro to insist more and focus more on efforts to support member countries to implement the preventive measures against hepatitis. Let me also end by thanking the regional director for giving effect to her promise. I was in Zimbabwe recently at the 67th session, and Burundi raised an issue. And in February, the regional director, in fact, sent us an external evaluation team. And this enabled us to determine our intervention capacity. So it was very good for us. We're very happy, and we are grateful to her for her leadership and for delivering on her promises. Thank you. Let me give the floor to Uganda and Botswana. Please stand by.
Thank you very much, Chair. Chair, I want to join my colleagues who have spoken in thanking the regional Director and the Secretariat for the very encouraging report for the work of WHO in the African region 2017-2018. I particularly want to limit myself to the epidemic preparedness and response, the NCDs. But before I focus on that, allow me to thank all the countries that have made progress in the elimination of mother-to-child transmission of HIV/AIDS. However, Chair, you will note that while a number of countries have made progress in this, we need to ensure that we put in place mechanisms to sustain these gains, because this still is a fluid area, and we need to ensure that we keep the momentum so that all mothers that are pregnant get to the health facilities in time so that they can be tested and be put on the option B+ drug. Chair, though our health systems have progressively been strengthened, and we now have more prepared. We are now more prepared to mount appropriately optimal and rapid responses to contain epidemics, including Ebola. A lot still has to be done. These epidemics, as you all know, show us the importance of regional and global solidarity and the quick decision-making when we are faced with these health emergencies. I want to commend the work of WHO in supporting the control of the epidemics and coordinating partner support in epidemic preparedness, and we all appreciate the critical role that WHO has been playing. Chair, the active community involvement, for example, the concept of the community health extension workers, has been shown to be very useful in delivering simple, affordable, and cost-effective early warning systems for outbreaks, ensuring case finding, and promoting appropriate health promotive and disease prevention behavior. And in our country, a lot of these alerts are actually given to us by the village health teams, and these are the community health extension workers. The interconnectedness of our health systems is clearly demonstrated by the regional and global panic that characterize hemorrhagic fever epidemics. A case of Ebola in North Kivu or Ituri in DRC means the next case may appear at a hospital in Uganda or indeed anywhere in the world because of the faster global mobility. The rapid mobility of the high refugee populations between DRC, Uganda, and the surrounding member states in Central Africa puts all countries at risk with this current outbreak. It is in this interest of all of us to support each other in building resilient and appropriately resourced systems to respond rapidly to any health threat. Uganda has over the years, Chair, built capacity and expertise in responding to these epidemics and is always ready to work with and support other member states in controlling these outbreaks. Currently, Chair, just allow me to inform colleagues in this meeting that, of course, we border DRC, and we have close to 40,000 people moving in between DRC and Uganda on a weekly basis. So as we speak now, we are not, of course, responding to the epidemic, but we've strengthened our surveillance systems to ensure that we don't have any case of Ebola crossing into the communities undetected. So it's important to strengthen our own surveillance systems and all the countries surrounding close to DRC. Chair, on the 24th July, WHO declared the Ebola outbreak in DRC successfully controlled, but unfortunately, 1st August, as you all know, we are having the outbreak. So, as this outbreak followed the WHO declaration of successful control of Ebola a few days earlier, we need to rethink our methodologies and criteria for declaring optimal control of these epidemics. This is just something, food for thought, Chair. On the non-communicable diseases, we have well-drafted policies and frameworks, but these are just policies that sometimes remain on paper. Though Uganda, with support of WHO, has conducted an extensive, deep analysis of its non-communicable disease burden, now and in the future, we lack resources to optimally respond to the growing NCD problem. And this, I know, is what all the other countries are facing. We need to get serious about prevention and health promotion to rein in the creeping NCD epidemic. The non-communicable epidemic will require massive amounts of resources, and no developing country can actually afford at our current levels of economic growth. I want to call upon partners to support the region with technical and material resources to prevent NCDs and promote healthy lifestyle. Uganda as a country has already declared every July, first week of July, a time when we shall be having the physical exercise day. We are glad that our president has been a champion for this, and we just launched this in July this year. So countries, Chair, should resist predatory marketing of NCD promoting products like sugar-laden eats and drinks, tobacco, alcohol, and other fatty foods. We need to do more as the political class to promote healthy lifestyles among our people. Chair, I want to thank you very much.
Merci, nous.
Thank you. I'll give you floor now to Botswana, I think.
Et le Zimbabwe se prépare.
Zimbabwe, please stand by.
Thank you, Mr. Chairman. I wish to join the others in congratulating the Regional Director for the report. And as Botswana, we wish to note the smart technical focus area and wish to applaud the efforts of the Secretariat in strengthening the regional capacity for health security, for effective preparedness and timely response to disease outbreaks and emergencies. We know that the implementation of the international health regulations, monitoring and evaluation framework has resulted in the joint external evaluations for member states, Botswana being one of the countries that were assessed. And on that note, Botswana, in collaboration with the WHO country office, conducted a joint external evaluation exercise on the international health regulations core capacity in December 2017 to draw national practices, indicators that reflect community strengthening and engagement. We envisage using the opportunities presented by the joint external evaluation process to assess public health emergency preparedness, hazardous chemicals, laboratory capacity, public health surveillance, radiation protection, protection against zoonotic diseases, as well as enhancement of food safety. The joint external evaluation exercise also sought to ensure that community-based surveillance and early response systems are included in all evaluations. This will improve future public health security and intelligence strategies. In that regard, Botswana has commenced the process of developing a national international health regulation action plan to address the gap identified by the joint external evaluation. The plan seeks to address priority activities needed to strengthen the country's core public health capacities. On that note, Mr. Chairman, Botswana knows the report presented and support the recommendations contained therein. Thank you.
Je vous remercie. Nous donnons la parole.
Thank you very much. I'll give the floor to Zimbabwe. Ghana, please stand by.
Thank you, Chair. Zimbabwe joins previous speakers to thank and appreciate the Regional Director's report and the given highlights of successes and potential areas of focus for better performance as we move forward. While we appreciate that we cannot report on every aspect of our work, we have noted over the years the extent to which cholera and related conditions like typhoid have grown to be significant challenges, particularly in our sub-region. While most of the underlying factors to these water, sanitation, and hygiene-related conditions are largely beyond health sector-specific interventions, it is the health sector that has to respond to results of failed water, sanitation, and hygiene interventions. We therefore need to make continuous noise about this, including in and through our annual report. Zimbabwe notes the RRD's report. Thank you, Chair.
Merci beaucoup.
Thank you very much. We're going to give the floor to Ghana, and Mali, please get ready.
Thank you, Chair. I join my other colleagues in commending the Director for the WHO Afro and the Secretariat. A very comprehensive, detailed, very encouraging report on health systems in our region. I particularly want to thank the Director General for highlighting Ghana's success in eliminating trachoma. I'd like to inform that we are still keeping in place our infrastructure and the systems we used in working towards that achievement. And just want to announce that we stand ready to share experiences with other colleagues who are working towards eliminating trachoma. On that note, I want to inform that Ghana has taken note of the report and we continue to work towards our way forward in trying to combat diseases in our region. I thank you very much.
Merci beaucoup.
Thank you very much. Mali will take the floor, and Comoros, please, could you get ready? Thank you very much, Mr. Chair. I would like to thank Madam Regional Director for her brilliant presentation. I also would like to thank and encourage the WHO with all the partners to accelerate a number of necessary and useful actions for the well-being of our populations, particularly in this part of Africa, sub-Saharan Africa. First of all, to be the acceleration of the implementation of emergency centers, whether it will be that the name we use or not, but the CDC, for example, which was recommended by our heads of state and has been recommended for a while, but these emergency centers at national level are all threatened, in fact, by a tremendous amount of emergencies. The experience of 2014, in fact, was very clear, and the experience of 2018 the same. We are in fact feeling the same threats and the same uncertainties, and today we think that countries are far from one another, but in fact they're not. They are very close. And the first thing is also the strengthening, and it's in fact something that has been mentioned by many speakers, notably by the President Macky Sall, is that we really need to review the health system in depth. And first of all, that we need human resources of quality. The countries and budgets, nationally speaking, can no longer, in fact, afford their training. And we seem to now start having the nostalgia for the past. And in fact, we need a reform. And this reform which has been spoken about is in fact almost like surgery, like we need to, in fact at the moment we are still using systems in some of our countries which in fact are systems that are older. They're more than 50 years old, and of course with ever-growing populations we need to review our systems, particularly operationally speaking, community systems and also in the peripheries. So whether it be for infectious diseases or non-communicable diseases, particularly care, hospitals very, very rarely in fact are able to do this. So it would be very, very good if the WHO would interest itself or take more interest in healthcare, in the management of hospitals and in the management of community health. We do speak about it and we talk about e-health, but in fact it is time to improve so that our villages in fact can receive health workers and can actually be seen by health workers door to door and face to face. And before finishing is research. We need to develop research. Because that is in fact what allowed us in fact to handle the 2014 epidemic, and in fact we are using the research which was a result of that epidemic today. So research really needs to be highlighted. The WHO needs to continue to make efforts in that sense, and certainly when we say that in our countries when we say the WHO has recommended it, in fact goes further than when a minister says that with his or her own experts. So the WHO needs to continue helping us certainly to develop the research and any action that would go towards research in maternal health and child health, the notifying also of deaths and births, and also reproductive health, the youth and water, for example. And also in the lack of security. There is too much insecurity in most of our countries. So it is time for us to develop actions which are specifically designed, in fact, for those areas where there is no security, so that we can at least ensure the minimum of healthcare, like immunization or treatment, for example, of tuberculosis. If we really want to speak about equity, if we want to speak about a very quick health cover, we need to become more and more aware of the difficulties that exist in those countries that are threatened by insecurity. So the WHO needs to continue. I know that many efforts have been deployed, many have been made, but still a lot needs to be done. And thank you very much, and bravo for the report. Thank you very much. I give the floor to the Comoros, and Benin, please, could you get ready? Thank you very much, Mr. Chair, and Regional Director. Ladies and gentlemen and heads of delegation, the Comoros Union would like to congratulate the Secretariat for the quality of the report submitted. Mr. Chair, we have noted that non-contagious diseases, in fact, constitute a very important part and are a double burden, in fact, for many countries. Mr. Chair, I am a member of the PID, and we would like to plea here for financial resources to be mobilized so that we can in fact deal with NCDs. Mr. Chair, the Comoros, with the support of our partners, has made very commendable efforts in terms of malaria. We would like to ask our organization to support us in this stride so that in fact we can reach the 2020 target. Thank you very much. I'd like to give the floor to Benin and then Rwanda. Thank you very much, Mr. Chair. We have noted through this report, which was pretty exhaustive, that many targets have been achieved, and certainly the improvement of the health of our populations where NCDs and non-NCDs are concerned. So our services are becoming more and more efficient, and also in the promotion of maternal health. Where we are talking about contagious diseases, Benin has taken the initiative to create a presidential organ, which is the National Council of the Fight Against AIDS, Tuberculosis and Hepatitis, which has the responsibility of coordinating all these resources. Since we've done this, there's been an improvement in the coordination, and the WHO has helped us calls for the establishment of a law in terms of hepatitis and also for the creation of a program against hepatitis. And I'd like to highlight this and to thank the WHO. I would also like to note that the support of the WHO has been constant in the last few years with the epidemics, with the Lassa fever. We also need to say that, of course, we do watch constantly, and the WHO is helping us very much. Where entities are concerned, the Benin has in fact a national response program for non-contagious diseases. We now need to mobilize resources, and we'd like to also plead with the WHO to help us towards this. I cannot finish without speaking about the support of the WHO during the last SIMSA, which we had to do, since today it is at the heart of the debate. So cyber health is extremely important, and we are also seeking funds for the implementation of the cyber health. I would also like to take this opportunity to say that my country is committed with a very strong political will towards universal health coverage and towards the implementation of the insurance component, which means that health insurance would actually be compulsory. At the moment, we will start a pilot, and this allows me also to help the regional bureau for a high-level technical assistance and also financial assistance, so that it would help us towards the costing and evaluation of the necessary investments for the improvement of healthcare. We would also need the assistance of the regional bureau to help us with this pilot phase, which we're going to start very soon. We would need very good documentation. Thank you very much. Thank you. We'd like to give the floor to Rwanda and Algeria, please. You'll be next. Thank you very much, Mr. Chair. I would like, first of all, to thank the Senegalese government and the Senegalese people for the excellent welcome that we have received. I would also like to thank the regional director for her report. I have 3 comments. The first comment is in that I would like to support my Ugandan sister where Ebola is concerned. But my comment is on the need to strengthen efforts made in countries where, particularly from countries where Ebola comes from. I find that very often efforts are not enough. So I would like to insist that the WHO help countries, help communities, and workers, health workers in hospitals to, in fact, be able to recognize how to prevent Ebola instead of actually putting a lot of efforts in contingency plans.
We can avoid crisis. Mon autre commentaire est sur le paludisme. J'en ai discuté avec la directrice régionale et on en a discuté.
I discussed a great deal on malaria, in fact, with my colleague, and we discussed also in Geneva.
Seeing opportunities from a lot of funders and from government to really invest in a regional strategy, because a country cannot pretend to eliminate malaria if we continue to act in isolation. And I would like us to take opportunity of the upcoming replenishment for Global Fund and other big organizations to put together the concept we draft during the WHO Assembly on malaria regional strategy. And I want to reiterate the commitment of the government of Rwanda, maybe to host a technical meeting on this before the technical meeting for the replenishment of the Global Fund happens. I think it's a good opportunity we shouldn't miss.
I would also like to advise countries that haven't yet adopted the model treat all, test and treat.
Regional Director, Dr. Moeti, we saw that some countries have adopted this model. What we noticed in Rwanda is that we started implementing this model, but the means to make sure that we properly implement didn't follow from big donors like a Global Fund, because once you start this model, you create a demand. So you have a lot of cases, you have a lot of patients to be put on treatment, and you need more means like reagent and human resource for the testing, for the treatment, but also for the follow-up of this patient. So I think there is an advocacy to do from WHO and even from heads of state to make sure that once we create a big demand, we can address the demand, because it would be very painful and unfortunate to raise expectations of patients by testing them, by telling them that we are putting them on treatment, and realize that we don't have enough consumables, human capability, but also drugs, HIV drugs. So that is an advice and an advocacy for all the countries that want to adopt these test and treat model. Thank you, Mr. President.
Je vous remercie.
Thank you very much. We'd like to give the floor to Algeria, and Chad, please get ready. Thank you very much, Mr. Chair. I would like to join my voice to other delegates to thank the Senegalese authorities and the Organization Committee for the perfect organization of this very important meeting. And we would like to reiterate also our congratulations to the regional director for the relevance of her report, and we certainly take note. We would also like to thank the World Health Organization for its support and for having declared Algeria free of polio, and also going towards freeing of malaria. I would also like to inform the honourable delegates that of the manufacturing, in fact, of the latest generation of medication for hepatitis in Algeria at very competitive prices, and this is in fact to respond to all the concerns of our brothers who shared all their concern, which was linked in fact to viral hepatitis. Thank you very much. Thank you. I would like to give the floor to Chad. And South Africa, please, you have the floor next. Thank you very much, Mr. Chair. I'm not going to thank the regional director for her report, or even anyone else for your election, since everything has already been done. I have taken the floor, Mr. Chair. It is the first time, in fact, I'm taking part at the regional committee, and I would like us, in fact, I would have liked us to have taken note of the report, because, in fact, all the points that will be discussed during these days, in fact, will take place. Now, having said this, I'm not just going to, of course, speak about my country or the region. I saw that there is a number of initiatives which are very interesting, and in fact would merit, in fact, to be shared with many countries. In terms of medication, I saw that there were examples of strategies, and that's the same thing for the World Fund, to help, for example, in terms of group, in terms of procurement, and to do group procurement. And if there is a possibility of this being done, if this in fact could be extended to other countries, because we have an enormous problem with the lack of access to medication. For example, the Gambia, there is an issue with tobacco. It's really a scourge in our country. We've got about 40 million cigarettes are sold every month in my country, and I think that the strategy, certainly the fight, I think that if there are very good examples to be had elsewhere in terms of prices and in terms of any legislation, I think if these could be shared, then we might be able to go further. We have seen very, very good examples, and I think that support needs to continue to be given in terms of data. We have an enormous problem with the lack of data in our country, and for as long as we do not, in fact, deal with the target populations and, in fact, have the data necessary, we are going to have an issue. So I think we need to strengthen, in fact, all our health systems, and the reforms, in fact, are at the moment underway, and they are very important, but I think we need more accountability in terms of all our partnerships. Of course, the issue of funding. We have plans, pluriannual plans, which in fact very often do not advance, and the bureaucracy also of the United Nations does not allow us often to have the flexibility or the reaction needed. And we have a lot of technical assistance, which in fact is needed and is not always there. Every 4 or 5 years, in fact, we keep coming back to the same themes, to the same analysis, and must be, in fact, part of any reform so that we go further. I would like to conclude by talking about coordination. WHO, in fact, plays a role of coordinator, whether it be technically or financially. But we continue with difficulties. We need to take very strong decisions to be able to coordinate all our actions so that we do not have plans which are in fact only done every 2 or 3 years and in fact do not go towards a single objective and achieve the results needed. We'd like to give the floor to South Africa and Mozambique. Please, you will have the floor next.
Thank you very much, Chairperson. I wish to congratulate you on your election and wish you well during your tenure as the chair of 68th session of the Regional Committee for Africa. We would also like to thank the government and people of Senegal for hosting this year's Regional Committee meeting and thank them for their hospitality. We welcome the report from the Regional Director, Dr. Moeti, on the work done in 2017-18. But we also wish to thank Dr. Tedros, the Director General, for his support for the region, especially the agency and agility with which the region as well as the headquarters have been dealing with the Ebola outbreak in the DRC. The continuing challenges remind us again about the importance of full implementation of international health regulations, as well as the importance of strengthening health systems. Of critical importance in responding to epidemics is to ensure maximum coordination both within countries, between countries, as well as between agencies. In terms of coordination between agencies, a strong working relationship between WHO Regional Office and Africa CDC is critical. Clearly, implementation of universal health coverage is key to strengthening health systems. We are pleased that Afro Universal Health Coverage Flagship Program has been established to support member states. Given the expanding experience in our region, it is equally important that country expectations, or country experiences are shared. I wish to report that as a consequence of a discussion between the Director General, Dr. Tedros, and my President, President Cyril Ramaphosa, our President has decided to lead the implementation of universal health coverage in South Africa, which we call the National Health Insurance. President Ramaphosa made this comment publicly on the 24th of August at a meeting of stakeholders convened to consult on the National Health Insurance Bill. Next month, the United Nations General Assembly will host high-level meetings on tuberculosis and non-communicable diseases, or NCDs. Our region must be prepared to participate in this historic event, especially as it pertains to TB. We know that the majority of high-burden TB countries are in our region, particularly the SADC sub-region. This is complicated by high levels of multi-drug resistant TB, as well as TB, HIV co-infection. If we are to eliminate TB by 2020, if we are to eliminate TB by 2030, we have to do more, and the high-level meeting with its 5 asks will be an important contributor to ending TB as a public health threat. However, for the high-level meeting to be a success, we have to ensure that as many of our heads of states attend the meeting and commit to ensuring that will elevate the elimination of TB in our national programs. I personally will be very disappointed if my head of state can send me to New York to represent him. We want them to come there personally, because this is a very serious issue. I've mentioned previously that the NCD epidemic is also before us, and that we cannot wait for a major crisis before we act. We will not be able to treat ourselves out of NCD epidemics, given, for example, the cost of treatment. This means that we have to strengthen our prevention programs. I'm pleased that the Director General, as well as my President, has implemented the working program, as we had before the World Health Assembly commenced, as well as yesterday's walk, although I could not take part. We must prioritize eating nutritious foods, increase physical activity, eliminating tobacco use, as well as reducing alcohol use. As a continent, we need to accelerate the implementation of policy and legislation to hold the use of tobacco use, including vaping. When we act together, we'll defeat the tobacco industry. A major contributor to NCD is fast foods, as well as consumption of fizzy drinks with high sugar content. We need to deal with both the social as well as the commercial determinants of health. This means being vigilant on the influx of fast food companies, for example. These are issues we must raise at the NCD high-level meeting in New York next month. We must also push harder to reduce the cost of diagnostics, medicines, and vaccines. We've been able to use our volumes as South Africa to help to reduce international prices, for instance, the viral load test, as well as recently the cost of betaquilin. Chairperson, in conclusion, I wish to make two proposals. Because, Chairperson, outbreaks are going to be with us. It's going to happen again and again and again. Whether it's Ebola, whether it's listeriosis, as it's happened to us, and any other outbreak we are still expecting to happen. It is going to happen. And my thinking, Chairperson, is that there are three reasons why outbreaks are going to be with us forever. The first one is climate change. None of us here can guess what climate change is going to bring to us. The second one, which is well established, is antimicrobial resistance. And the third one is the fact that humanity is fast encroaching on the habitat of other organisms in search for food and space for our own habitat. So for this reason, I want to propose that the simulation exercise on the outbreak of diseases, which was given to us for the first time at G20 in Germany last year, be repeated every time we meet. We were able to do it for SADC, Chairperson. I can tell you it helped me. When I was going through that exercise, little did I know that 2 weeks later, I will be faced with an outbreak of listeria. And the manner in which we dealt with that outbreak was the lessons we learned from the simulation exercise. I know that many ministers here might have gone through such simulation exercises, but there are always new entrants as ministers who need a similar experience. My second proposal, Chairperson, is that in Victoria Falls, the Director General came with a new concept, a new entry in our lexicon, which he called the commercial determinants of health, as against just the social determinants of health. This concept doesn't exist in the World Health Organization programs. It was new, and I want us to propose as Africa region that this be taken up and be endorsed in the next World Health Assembly as one important program. Chairperson, I don't want to waste your time, but there's a big pushback from industry on what you are doing to combat the NCDs. The tobacco industry is pushing back even in those countries which have got laws In my own country, they are even mobilizing the unemployed and the poor to fight for them. Because the new strategy they are using is about employment. That any rule you do to control tobacco, alcohol, and sugar, you are bringing down, you are destroying jobs. So we would like the World Organization in our region and even in Geneva to help us by issuing statements almost every month to support us in this battle. Because in some of our countries, they believe it's the madness of the minister that people must not smoke or drink or eat sugar. They must understand that is the whole world. So I wish to thank the RT and her team for the progress we are making in the region. But I do think that we need a bigger push to ensure that we meet the SDG targets. That's why I want both the region and Geneva to get involved in the battle against NCDs by issuing statements to support us. Thank you very much.
Je vous remercie, Monsieur le Président. Nous donnons...
Thank you very much, Chair. Now, Mozambique, followed by the Central African Republic. Thank you very much, Chair. Allow me to begin by congratulating you for having been elected this morning. And I also join my colleagues, all those who spoke before me, who would like to congratulate the organizers of the event, and in particular let me commend the report presented to us by Madam Regional Director Dr. Moeti. Chair, I asked for the floor because I'd like to focus on something I believe to be cross-cutting. Cross-cutting in order to reduce health problems caused by communicable diseases, as presented here today. The issue I raise is the following. Is there a possibility at the highest of levels for UN agencies, the WHO and other UN agencies, to advocate with a view to promoting greater intervention in terms of sanitation specifically? Our countries have had a lot of issues to do with massive production of waste, and we don't have a waste treatment capacity, the kind that would be required to promote a better habitat. What we're doing is we're creating breeding grounds for mosquitoes, and in connection with this we have the issue of water to consider. That leads to cholera transmission, and sooner or later we'll also see problems to do with diseases such as rabies and other zoonotic diseases. I want to believe that it is possible for governments to consider action that will help focus on improving our environment at a regional level. I think this, of course, would contribute greatly to the reduction of problems such as these. When we talk about malaria, I think that something that has oftentimes been neglected is the fact that we need to focus also on larvae. We need to focus on combating the larvae, especially during the rainy season, so that we reduce the number of mosquitoes, so that when the rainy seasons arrive, we're able to reduce the reproductive capacity of this insect. How can we promote this kind of action so that other sectors can help us, contributing, so that working in partnership with the WHO, we are able to truly ensure that our work has a great impact. In Mozambique, we have taken steps with a view to doing exactly this. We have wanted to create a group effort to fight this type of pathology. We've involved a number of different ministries in the effort, but I hope that a higher level action with UN agencies will contribute to this effort. Thank you.
Merci beaucoup.
Thank you very much. I will now give the floor to the Central African Republic and then Cape Verde. Thank you very much, Chair. Congratulations for having been elected to this post. I'd like to thank the WHO team under the leadership of Dr. Tedros. I think we've seen great group work. We see there's an alignment of the different leadership levels of the organization. There's greater coherence. We see there's unity, and this is a great example for the whole of our health community to follow. I hope that Dr. Tedros and the regional director will continue to promote this leadership with all our health partners so that this unity is also reflected in all countries, including conflict countries. In those cases, specifically conflict countries, allow me to focus on them. I know that the WHO has done a lot for conflict countries, but there isn't a specific emphasis on them in this report, I believe. In Congo, Sudan, I think we haven't seen a report on the efforts being made in the Sudan. I think we need to see the work done by the organization in these conflict countries better reflected in the text. This is important to focus on. I would also like to ask the WHO to become more involved in advocating with a view to making sure our member states deal with issues pertaining to health in conflict situations. As my colleague and dear brother from South Africa talked about social determinants on health, we must also talk about political determinants. Conflicts often have commercial roots and political roots, and it is the member states that are involved in these conflicts. We can't come and talk about universal access if we're talking also about states being involved in conflicts. This is very important. It's very important that this be part and parcel of our debates. Perhaps we haven't noticed, but I'd like to say the following. Everybody is exposed to this. Whenever there is an Ebola alert in the north, for example, in this particular case in the Democratic Republic of the Congo, I remember in the peacekeeping mission, we couldn't immediately go where we needed to go. So on the ground, I realized how this Ebola virus, how this epidemic generates a global risk. We're talking about people that move around in different regions, who are mobile. As my sister from Uganda said, we mustn't forget about the fact that people are moving across different areas in Central Africa. People are moving around, herdsmen from Uganda penetrate the Democratic Republic of the Congo and return to Uganda. So we can't forget about the risk of the epidemic. There is a part that's regional, there's a part that is national, but we mustn't forget the cross-cutting nature of this. Otherwise, we will not be able to deal with the problem. So we need to assess the risk of Ebola in the world, but we need to review how we do so, and do so carefully. Support given to countries. There's something else to do with global commitments. Global commitments undertaken, the ambitions we lay out worldwide are not always reflected on the ground. That's the case of AIDS. Somebody talked about the World Fund. There are commitments that are undertaken with a view to accelerating efforts on the ground. We need to think about all those who are ill, but this isn't always reflected in what's happening on the ground. We have ambitions, we allocate based on countries' ambitions, but we haven't got universal coverage, and we won't be able to eliminate the problem in 2030 if we continue with the same approach. Madam Regional Director, I know that the epidemic in the Democratic Republic of the Congo has produced great pressure on us all, but I think we need to have differentiated approaches. There are hotspots, but we need teams also that help countries that are more immediately at risk, help them to prepare, not to promote surveillance, but to prepare to react when needed. As the friend from my brother from South Africa said, if there's an epidemic in the Far East, and if I go there, I don't always know what I'm going to do to deal with HIV, AIDS case or Ebola cases if there's been a situation where Ebola has been declared to exist. So when we have an epidemic before us, we don't always know how to act. So it's important to have exercises that will simulate the situation. We need teams that will support people on the ground in hotspots. We need people who go to the border regions to simulate real-life situations that might occur. Thank you once again, Chair and colleagues from the WHO. Thank you for the good work done. Thank you very much. Now, Cape Verde, you have the floor. Thank you very much, Chair. Allow me to begin by congratulating Senegal for having hosted the 68th session of the Afro-Regional Committee. Let me also congratulate the Regional Director for the report presented and for leading the transformation agenda, which is contributing greatly to the improvement of health in Africa. Allow me to also draw your attention to the small island nations such as my own. We need quality, affordable drugs. That's very important to us at the present time. We have a double burden of chronic diseases that are not communicable, but also communicable diseases. We have high level of hypertension, 35%, higher than 35% in our population, diabetes at around 12%. So we really do need affordable quality medication so that we have better surveillance, better control of patients with a view to reducing complications from the disease. We thank the WHO for helping us with pooled procurement. We have a special project for SIDS countries, and we're working towards implementing this project. We also have to look at climate change which affects island nations. It has a great impact on health and other social determinants. In 2017, we saw a great drought on the islands, and that has had an impact on health and other social determinants. So we continue to count on you, on the WHO, so that we can improve the indicators in the country and in the region. If we really do want to achieve universal health coverage, this is essential. Thank you.
Je vous remercie. S'il n'y a pas...
Thank you. If there are no further comments, with your permission, I would give the floor. No, Congo has asked for the floor. Thank you.
Merci, Monsieur le Président.
Thank you, Chair. I apologize for taking the floor late. I would like to commend the progress made by Afro with respect to vaccination against yellow fever in Angola, DRC, and Nigeria. But all the same, I would like to express a slight bitterness on the part of Congo, DRC, with respect to the fact that this intervention should have been sub-regional. On 23rd August, a few days ago, Congo had to declare a yellow fever epidemic, and we suspect that they come from the Angolan province of Cabinda. So this amply demonstrates that a sub-regional approach that would have included the 3 border countries that are at risk, DRC, Congo, and Angola, would have been more effective than working with Angola, skipping Congo, and then moving on to DRC. So this country was left out in spite of all our requests to the WHO on this matter. So we would like to insist, as other ministers have said, on the fact that approaches to outbreaks should be sub-regional going forward. There should be approaches that involve several countries so that we can avoid a situation where the outbreak is controlled in one country and then it breaks out again in the neighboring country. Thank you. Thank you. If there are no further interventions, we can give the floor to Dr. Mweti to respond to the comments. Thank you. You have the floor, Doctor.
Thank you very much, Chair, for giving me the floor to make some comments. And I'd like to very much thank the honorable ministers, the heads of delegations, for this very rich contribution, response, your comments, your orientations and suggestions as far as our work is concerned in the region for the past year, and the recommendations that you are making in order for what we are doing to be of better utility to what you are trying to do in countries, working with partners in order to improve health in its various aspects. We appreciate very much this, this guidance, these suggestions, and they form a huge part of the material that we will use to incorporate into our strategies going forward, how we adapt the work that we are doing in order to support you better. Many of the comments that were made were in the form of suggestions or highlighting some challenges. So I will just respond to several specific issues that were raised in terms of either clarification or indeed underlining the fact that we will take forward what you are suggesting as far as our work is concerned. So I'd like to make reference to the comment, first of all, from the Honorable Minister or the delegate from Burundi. Merci d'avoir fait allusion.
Thank you for making reference to hepatitis and the complexity of response by those responsible for the program in our health system. Let me assure you that a few years ago, the WHO started trying to mobilize resources to build a response capacity to hepatitis. We also restructured at the regional office the unit responsible for this. At the moment, the program is with HIV/AIDS and tuberculosis. I can assure you that after this restructuring, we received a lot of comments expressing surprise. But we do believe that we can try to see whether where we have placed the program will facilitate things. We have synergy between the HIV and hepatitis programs. We were able to build capacity at the regional office. We recruited some experts and we're better equipped to support countries to work on this program. So thank you for emphasizing this. We do realize that it's a priority. It's a major public health concern in our region, and up till this moment it has not received the necessary attention. So thank you. We shall continue to build our capacity to improve on how we work with countries.
Provide some clarification as far as the declaration of the end of the Ebola outbreak in the Democratic Republic of the Congo on the 24th of July. This is a concern that was expressed by two ministers. And I assure you that these are two completely separate outbreaks. One was on the extreme western side, northwestern side of the country, and the other is on the extreme northern side of the country. And analyses have been made that assure us that indeed we did have an end to the epidemic in the northwest, and we have a new epidemic in the northeast. It is not a matter of an epidemic having passed across the country undetected. Having said that, we are very aware of the need to continue to improve the surveillance, early detection systems in the DRC as well as in all our member states, so that we can indeed track and follow the outbreaks more precisely and accurately. The Health Minister of Mali made several suggestions, and thank you for those that pertain to how to better reform, how to improve the work that we are doing currently on reforming the health systems in our countries. Indeed, we are very much focused in the African region as part of the framework that we are proposing on several elements. First of all, on a really effective decentralization in our health systems, because we recognize that in some of our member states, the distribution of resources continues to be focused in centrally, in hospitals, in urban areas, and when you get down to the peripheral level, to the district level, we do not actually have districts that are functioning in the way that we had in mind when the Bamako Declaration, for example, was adopted some years ago. We are also very much interested in continuing this to the community level. And it has been highlighted by several ministers that this is not only a node where we can improve access to services, but also where surveillance and other aspects of public health work can also be strengthened. We are promoting very strongly what we call integrated service delivery. So to help to define an essential package of services and to try to break down the silos that the Director General referred to earlier on in terms of how these services are put together in a primary care setting, in a community setting, at the district referral, first district referral level, etc. We welcome very much your reminder that we need to learn as we are implementing, so action research needs to be improved. I know that the Honorable Minister is a keen researcher, so thank you for that reminder. We need to continue to build the evidence base from concrete experience which is adapted to the context of our countries. We will continue to do so. And then on the comment on how to operate in areas of insecurity. Building on a comment that was made by the Honorable Minister of the Central African Republic earlier on when we had a call with the Minister of the DRC about what we are learning about how to pursue work for polio eradication, for example, in areas of insecurity. We observe as your Secretariat that we are learning a lot in your country, around the Lake Chad, around Nigeria, in the Central African Republic, and in other countries that have to strive in protracted context of insecurity to provide basic health services to populations, as you very well mentioned. I believe personally, and this is something that we will pursue, that we need to work on exchanging experiences from different contexts of how countries have learned to find if you like, corridors of operation under very difficult circumstances, who to work with, how to work with communities, how to work with the security forces so that we're able to get in and pull out when it is necessary, and to be able to establish those links that enable the health workers to have intelligence, to have information about where the risks are greatest and where the risks are less, which would permit the operations to continue. So we will, within the region, building on the work that we have done, particularly on polio eradication, but also building on what I'm sure you have learned, other countries have learned in the context of trying to continue to provide basic services to populations, pull together some information, perhaps organize some reflections, joint reflections about how to build on this experience to really know what to do and be more effective under these contexts. We have been reminded of the need to, by the Honorable Minister of Benin, merci beaucoup, vous nous avez rappelé de l'importance de l'assurance.
The importance of health insurance to help countries to achieve universal health coverage. Many member states are putting in place the health insurance mechanism. It is also important because we need to define the package that will be covered. This is what is ongoing in several countries. We're putting together the various experiences and information to see how to address this. I have noted your request for support on this in Benin. Thank you. You also raised the importance of the regional strategy for the elimination of malaria. This goes hand in hand with the comment made by the Honorable Minister of Rwanda. We'll see how to work not only to address countries that have the biggest problems of malaria, so as to make progress in the elimination of malaria. Thank you for this. The Honorable Minister of Rwanda also spoke about the need to carefully address the treatment guide. We have taken note of this. We believe that countries carried out some estimates and projections before started, and we can work with donors and the major financing mechanisms to see how they understand the efforts of the countries. The WHO is one of the partners of the Global Fund, for instance, and we hope to have a dialogue with them to see how they can continue to support countries to ensure that they can use these strategies that were agreed upon by partners at global level. The Honorable Minister of Chad asked us to see how we can give more support to countries with respect to group procurement. We'll continue to look into this. In the past, there were various experiments by various sub-regions. And what we learned was that the major concern is funding. That is to ensure that the financing is available. Every time that we have this pooled procurement, each party makes the funds available in time so that it works. That has been the major challenge, but it's something that we're going to continue working on. And we shall also improve on how we share experiences of the various countries that have adopted legislation on tobacco.
Suggestions and counsel. I would just like to indicate that we are indeed working with the Africa CDC. We have agreed on a collaboration agreement. We are expecting the Africa CDC to visit us in Brazzaville in October so that we can review how our collaboration has gone at both the regional, continental level, but very much at the country level. When the Africa CDC contributes to response in outbreaks and epidemics. They are very much operating within the framework of WHO support. So at the operational level, we very much are working together. At the regional level, we have agreed how to work together, and we are going to reinforce this in a couple of months to reviewing how it has gone. Thank you also for all the suggestions that you have made, including on how to highlight with more emphasis the influence of commercial interests, including some of the industries that are driving the sale of some of the commodities that place at risk our health, particularly as far as non-communicable diseases is concerned. We will try to do better, this is to the Honorable Minister of Mozambique, on advocating for intervention by other sectors, multi-sectoral action, particularly you highlighted water, sanitation and water. We have a strategy for how to support countries to engage in multi-sectoral work. We have to admit that this is something that we are learning together with you, and we have advocated with our representatives and at our own level that our engagement on health is not simply with you, Ministers of Health. We have also to make our voice heard as far as other critical sectors are concerned in order to ensure that their actions don't aggravate some of the risks that we face together in health. Thank you very much, Honourable Minister. Merci beaucoup, Monsieur le Ministre.
Thank you, Honourable Minister of Central African Republic, for reminding us of the need to share information on what we do in countries in conflict and having humanitarian crisis. We shall revise our report because indeed a lot is being done in countries such as South Sudan and your country. And we're also learning a lot from all of this. We shall continue to improve on how we work to prepare neighboring countries for the eventuality of an outbreak, not only in terms of surveillance, but also in terms of response. I had the impression that we were doing it, so maybe what we need to do is to improve on what we are doing to make it solid and ensure that you are ready to respond. At any rate, the message with respect to this tests, with these simulations, was something we heard you loud and clear, and we will work on this.
Not to be too long. I'd like to make a comment on how to have cross-border and what might be called sub-regional both preparedness and response to outbreaks. It's true that WHO over the years has worked with member states to put in place mechanisms for cross-border collaboration. And our observation is that they function when there's an epidemic, and when the outbreak is finished, they fall into disuse. So we'd like to also, in a way, ask our member states, how can you sustain the mechanisms that are put in place so that neighboring districts in your countries continue to exchange information, continue to work together for preparedness and response if there is no outbreak going on? We would hope that these would become part of the resilient health systems that we are working together to put in place. And that component of resilience is sustained from the central level by the ministries, by the government, and also by WHO. On the specific matter of yellow fever, I think when we were going through the outbreak in Angola, we had not yet developed a new strategy which has been adopted on yellow fever. And at that time, the availability of yellow fever vaccine was only in response to an actual outbreak in a country. Now, we have worked with partners, particularly with the support of Gavi, to put in place a new strategy for eliminating outbreaks of yellow fever in the region, which will enable us to have access to yellow fever vaccine, both for prevention and also for responding to outbreaks. And I hope then this will enable countries to be able to have access to vaccine in order to prevent outbreaks happening in the context of a new strategy that has been developed since we had the outbreak in Angola. So I'd like to finish there by thanking you very much for your guidance, for your comments, and to assure you that we have heard some of the requests that you have made. We will adapt our strategies on what we are doing in the region so that we are better able to support you. And here, acknowledge very much all the partners that we work with for the contribution that they make to our collective efforts to work with our member states. Thank you very much.
Je vous remercie.
Thank you, Dr. Moeti, for your responses to the comments. Director General, perhaps you have some things to say. You have the floor.
Thank you, Chair. I will be brief because Dr. Moeti had already responded in a very comprehensive way, and she has responded to almost all issues raised. But I will focus on two issues. One is on health security, and then the second one is on UHC and primary health care. If I start from the emergency preparedness, I will just share our experience, my experience, and CD's experience that we believe can make a difference. On emergency response, preparedness and response, I think the most critical thing is taking ownership or commitment at the highest level possible. And if you see what happened in DRC with Ebola, the government's commitment, and especially the health minister's commitment, was very, very strong. You may not know, but since the first Ebola outbreak, he hasn't left the country. He even was camping in Itipo, in Bikoro, and Bandaka. This is in the western part of the region where the outbreak was raging. After the Ebola in the west was put under control, and another Ebola outbreak started in East. By the way, the two outbreaks are unrelated. We have already determined that genetically. He again moved to the eastern part, this time to northern Kivu, as you know. And these are the places called Beni and Mangina. And he travels there regularly, especially the area where the current outbreak is happening. It's actually an area with active conflict. And it's risky, not only risk to Ebola infection, the minister could be also contaminated, but security risk too. But you can see the level of commitment he has. And he travels there regularly, and he checks things firsthand, and he responds or he proposes ideas on how to respond to the developing ideas and addresses them. So he's leading, if you like, from front and center. Meaning if there is government commitment to this level, then containing an outbreak can be actually handled in a better way. So that's number one. So this reminds me of, for instance, a health minister as a commander-in-chief of the health security. This is something that you don't need to delegate. I mean, there are people who are going to do it, who will support you, but at the top, you should do it yourself. That's one lesson. And second, it's a 24/7 work. So there should be daily report, even real-time report. You need to have reports from the front line on what's happening regarding some major health problems, like it could be cholera, it could be Ebola in this case. It could be Marburg, it could be H1N1, or it could be anything. But there are diseases that you know that has to be followed up very, very strictly, and it's a 24/7 work. And in addition to that, from the issues you raised and what you are doing, something that we need to speed up is the evaluation of the IHR, and that has to be done at the highest level by you, and see what are the gaps and try to fill the gaps. And the third is related to what Minister Aaron said on simulation. Not only doing IHR, having regular simulation also helps. Because as Aaron said, first it prepares the mind. You have that emergency mentality. And you can check also how the process responds. And third, you can check logistics preparation. So three things helps you, three things with simulation. Preparing the mind, checking the process and improving if there is any defect, and preparing the logistics. And this is very, very important. But all this, to be honest, could be in emergency preparedness and response. We can have a better strength if we strengthen the primary health care. So that's why the second issue I wanted to discuss with you is the primary health care. We have been talking about universal health coverage, but from universal health coverage, I think we have to take primary health care as the foundation of it, and something that can be built quickly. Especially in our continent, most of the health problems are communicable diseases, as you know, and can be dealt with at primary health care level. And many of the life course issues, be it maternal or child health issues, can be dealt with at the primary health care level too. And even NCDs, the risk factors or the root causes of many of the non-communicable diseases can be dealt with almost all at the primary health care level. So strengthening the primary health care is important. And strengthening the primary health care means building the vehicle, meaning addressing the workforce issue, the information issue, the health financing issue at that level, the governance issue at that level, the access to medicine issue at that level, the surveillance issue at that level, the emergency preparedness and response issue at that level, at primary health care level. Not only the system issues, you have to also identify the service issues based on the country situation. What packages of services? In our continent, mainly will be communicable diseases. Of course, you will have the non-communicable diseases, life course, and so on services as packages. So there is the system issue, the vehicle on one hand, and the services that can be provided on the other hand. And the services that could be provided should be seen in relation to health promotion, disease prevention, early detection, and treatment. The health promotion and disease prevention part will be a guarantee as part of the emergency preparedness and response. Because it's a strong health promotion and disease prevention that can give you better guarantee in terms of avoiding outbreaks, or if they happen, you can detect early and address them. So building the primary health care has two benefits. One, we can provide the services at that level and we can make it community-based, but at the same time, our security, health security improves. So primary health care saves lives, provides better services, because it provides better services at the closest possible location, but at the same, not only saves lives, but at the same time saves resources also, because it can be built at a very cheap price compared to building a hospital. You know what's happening in our continent. I was a member of parliament myself, And whenever I go to my constituency, the first question that comes is, Tedros, we need a hospital. But in many places, to be honest, hospital is not the answer. But we try to do it because we want the votes. But the right thing to do is to convince the communities what would be even more beneficial to them. Instead of going to the hospital after being sick, the primary health care and the communities together should focus on health promotion, prevention and early detection and treatment, and keep themselves healthy. So primary health care is good for services, and primary health care is good for health security, to increase emergency preparedness and response in our continent. And the reason I'm commenting on emergency preparedness and response plus the primary health care is, as we're preparing for the Astana conference, which is the 40th anniversary of the Almaty Declaration of Primary Health Care, we need to have a renewed commitment for primary health care. And I ask actually our ministers from our continent to take the lead, to recommit to primary health care, because it saves lives, because it has a bigger dividend also, and because of all the benefits that you know. I don't need to tell you that. But I think we need to have a renewed commitment. All the issues you said, be it malaria, hepatitis, HIV, TB, then all the non-communicable diseases and the services we provide using the life course approach, all of them, or most of them, or most of the services, and the estimate is 80%, I think, can be handled at that level. Hospitals, I think, are used after we are defeated, actually. And I urge and ask you, as my colleagues, to really recommit to this, and in Astana especially, to really go as a big force, to recommit and have a strong primary health care in our continent, that can address many of the problems that we are facing. So thank you so much. With that, the issues you raised were very, very rich, and this will help us to also serve you in a better way. And I'm glad that I have this opportunity to learn from you and also express my opinion regarding what we can do as we go forward. Merci beaucoup. Thank you, Chair.
Je vous remercie, Michel.
Thank you, DG. We have completed the discussion of the report, and bearing in mind all comments and suggestions, plus the response from the RD and the DG, I believe that we can now consider that the committee is ready to take note of the report of the regional director. Thank you. Dr. Zawaira wanted to make a suggestion.
I can't see where to switch it on. All right, great, I have it. Thank you very much, Mr. Chair. Honorable ministers, delegations, I'm going to ask you to stand up, please. We have been told that sitting is the new smoking. So we need to get some air into our systems. Can we have some music, please? Some music, please.
If no music, then let's just stretch. All right, can you stretch your right hand? Stretch, stretch, stretch. Stretch the left hand. Stretch, stretch, stretch. Go backwards. Oh, we are all getting old, eh? Okay, can we twist? Can we twist? Let's twist. Let's twist a bit more, a bit faster. Faster, 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 faster. All right, can we stretch both hands? Reach to the sky, reach to the sky, wave. Afro, oh yeah. Thank you.
Je vous remercie.
Thank you. That was most welcome, especially as the dance comes in place of the coffee break. Distinguished ladies and gentlemen, we shall now take a short break from our formal schedule to receive a special briefing on the Ebola outbreak in North Kivu, Democratic Republic of the Congo. I pass the floor to the head of delegation of the DRC to say a few words. Dr. Leon Nkolomoni, you have the floor, please, to brief us on this outbreak. Thank you, Chairperson. On behalf of His Excellency Dr. Oli Ulunga, who is unavoidably absent precisely because of this outbreak, I would like to extend to you his greetings because he is fully appreciative of your election as chairperson of this regional committee. He also sends his greetings to Dr. Gabriels, the Director General, and the Regional Director, as well as all participants at this regional committee meeting. As you are no doubt aware, since the 1st of August, the DRC has officially declared the 10th Ebola outbreak in the North Kivu province. What is peculiar about this outbreak is that it affects 5 health zones. First Babalako, then Beli, Osha, Musienene, and Butembo. In addition, the neighboring health zone in another province, Mandima, is affected by this outbreak. DRC has had 10 EVC outbreaks since 1976 and 1,000 odd cases and a lethality figure of about 71%. The last outbreak was ended on 24th July in Kinshasa, and the regional director was there. 6 days later, there was this fresh outbreak. The analysis that we carried out led us to realize that the 2 outbreaks came from the same viral source, that is Ebola Zaire, but the serotypes differed one from the other. This one has a strain that is closer to the Lekati outbreak of 2017. As soon as it was notified, the country, alongside partners such as the WHO and others, set up pillars to respond to the outbreak in Beli. The various committees are working hard, and under the leadership of the government of the DRC, they are trying to respond rapidly to the problem in the region. Before coming here, we were given the latest information. To date, 111 cases have been reported, and out of them, 83 are confirmed cases. As you can see, most of the cases are in the Mabalako Health Zone, and more specifically in Benin, the town of Benin. North Kivu province is one of the most densely populated provinces of the DRC with about 8 million inhabitants. The 6 health zones affected account for about 1 million inhabitants. We saw that the number of deaths from cases confirmed is quite high. So with this, we can say that the first probable case following the investigation of contacts dates back to May, but it was on the 12th of July that the first confirmed case was seen. And today, we're well into the response because all the committees are functioning and we are detecting as many cases as possible. This is where we stand now, and this is what we continue to work on. The number of contacts investigated is on the increase. It's true that this is a region with some armed conflicts, but the teams continue to work to find all the contacts listed so as to examine them. Next slide, please. Vaccination started on 8th of August, and to date, 3,591 persons have been vaccinated, with 1,022 in Mabalako, 761 in Beni, 867 in Mandina, and 121 in Ocha. With the support of the WHO and MSF, the committee has set up 2 operational care centers in Mandina and Beni, and others are being built in Goma and Makereke, the neighboring provinces. 5 products have been accepted by the Ethics Committee, and out of the products that have been tested, 10 patients have had the products developed by the professor, and they have been healed. Another one received the other product and is still undergoing treatment. Chairperson, this is what I can say briefly about the current Ebola outbreak in DRC. I would like to thank the partners that we have, WHO and other partners, that have given us a partnership that enables us to respond adequately. Thank you once again.
Je vous remercie, docteur.
Thank you, Doctor. I'll now give the floor to Dr. Soixante-huitième, WHO Regional Emergencies Director for Africa.
Merci, Monsieur le Président.
Thank you very much, Chair, Chairperson, Honourable Ministers, Director General, Regional Director, dear partners, dear colleagues. It is a pleasure to, on behalf of the Secretariat, give you an update on the response of our partners to the Ebola outbreak in the DRC. We were fortunate to have the representative of the Congo who arrived just before the session, which will allow me to skip some of the slides that have already been presented to you. It's important to see this as a regional and global security issue because it can spread in the region but also spread worldwide. In our region, there are around 20 countries that are prone to the Ebola virus. So we have to think about the risks and the vulnerability, the risks in terms of limited capacity. All of this means that we need to think about prevention and preparedness when dealing with epidemics. And this shows us that we're talking about a priority matter. When it comes to the Democratic Republic of the Congo, we're talking about a particular situation. It's not because we have a second epidemic that things are easier. Each epidemic is a specific case. There are different specificities. Each case is different. And when we think about the humanitarian situation as well, we know that in the North Kivu, we have a conflict that has been going on for 20 years. There are armed groups that continue to operate in the region, and it is against this background that we have to send our staff to the region and work with partners to try and contain the epidemic. You heard the representative talk about 9 previous epidemics in the DRC. We know that these are all different types of epidemics based on the different context. In North Kivu, this is the first time that we see an EVD epidemic. So even health personnel is not used to manage this type of epidemic in this region. Around 15 health professionals have already been infected by the epidemic. They were highly exposed to the virus, and they didn't have the minimum level of protection required. They didn't know how to deal with the cases before them. We have already heard about the number of cases, but allow me to show you the trend, the epidemic curve in terms of symptoms. You can see the peak was a few weeks ago. We're in the active stage, but we're maintaining efforts to reach the end of the epidemic. Proximity to other countries, of course, complicates the situation. When we talk about the geographic proximity, we have to talk about Rwanda and Uganda. The collaboration with these countries is important. We need to detect but also contain very quickly all of the different cases. Of course, the work is not limited to Rwanda and Uganda. In the Equateur region, we had teams to help the 9 border countries, and this is continuous work. It's important also to say that preparation doesn't begin with the epidemic. We have to begin before. We have to identify the weak points so that we can work with a view to preparing. It's needing to prepare for warfare. I won't go into the pillars of the Ebola response again, but it is important to highlight that surveillance and monitoring of the different contacts is important in this region where security is an issue. We have to talk about working with centers in these communities. We need to have active surveillance. In many of these areas, we're talking about issues of access. We work with the UN missions, we work with UN partners to make sure that we have secure operations undertaken in this area. We have more than 70 people only from the WHO working in this region, and we work with partners from the Health Ministry, and others are also on the ground. With regards to research for action, it's important to make sure that we look at the issue of experimental vaccines, and at the same time we have experimental therapies used in developed countries. In West Africa, we had people who were infected, people from developing countries. They benefited from this experimental therapy. And of course, that is important so that we also give all other people affected by the disease an equal chance. Vaccination is actually ring vaccination, so it's a case-by-case basis, but also people close to the family in certain areas. It's difficult to identify all cases, but it is important to take into account we're talking about geographic issues, and also recommendation of the Strategic Committee of experts has guidelines that also need to be followed. A number of people have already been vaccinated, and I think this will help interrupt the transmission chain. Contact tracing was presented to you earlier, but as you can see, there are certain days where it was a difficult situation. There was resistance at community level in certain cases. This is the first time that this region is experiencing an Ebola epidemic. So communication is of the essence. We need community engagement. We need to work with community leaders and liaise with the whole population. So it's ongoing work. With regards to the response, of course, response is expensive. The planned budget is $44 million. That's a lot of money. Thankfully, the response to the previous epidemic helped us mobilize resources that were now reprogrammed. From the first day, we were able to free up funds for contingency funds, emergency funds that were reprogrammed from Equateur, 13 million. And also new funds have been mobilized thanks to the commitment from our partners. The credibility of the institutions involved in this combat is also extremely important. The leadership of the government is important as well. We have a lot of partners working on the response to this outbreak, which is very positive. This just gives you an idea of the sequence of actions undertaken. We were notified on the 29th of July of suspect cases. The ministry team and the WHO team went to the area, and on the 1st of August we confirmed the epidemic. That very day we are able to analyze the risk and set up an action plan to manage the incident. We need to have contingency plans. Of course, we need 2 planes for this particular region, which is also expensive. Thankfully, we had the support of the UN mission and other partners, such as the World Food Programme. So we have been able to deploy teams onto the ground very quickly. So these are all obstacles that are costly and that we needed to look into. We had very high level of support in the WHO. We were able to visit the terrain, visit this area with the teams from the Health Ministry. Challenges. Well, we've explained them already. Mainly we're talking about needing to progress more quickly than the virus. We need to be one step ahead. We don't want the geographic area to become larger. We want to contain the geographic spread. We want different partners to be involved in this fight. We need to focus on surveillance, and that means we need to look at and identify the cases and treat them as quickly as possible. Community engagement is also important. I talked about vaccination and talked about security challenges, but with the teams on the ground, what we see is when a new case is identified, the teams within 24 hours carry out all the research required, carry out vaccination around that case, and this is very important. So all these different response elements are in place, but we need to sustain the efforts currently being undertaken to contain the epidemic. But it still is a challenge, and we are aware of that in all of our work. A lot of partners work with us. The UN system, the World Bank, the AFDB, the African Union, the Africa CDC, but also the WHO network. We have an additional 40 partners listed here on this slide. So as you can see, this is teamwork, and so coordination is of the essence under the leadership of the Health Ministry. But it's the coordination of all these teams by the WHO, all of us working towards implementing the same action plan that allows for our goals to be achieved. It also means we need to make sure resources are being used with a view to implementing the same plan. We believe that we are on the right track despite all the challenges, and we hope to see the end of this epidemic soon. So I think we have the highest level of commitment. I think people around us here today at this top table have already visited the most difficult areas to support those on the ground and to try and find the best solutions. Thank you.
Je vous remercie, Dr. Fall.
Thank you very much, Dr. Fall. I don't know if Madam Director, the Regional Director, would like to add any additional comments.
Thank you very much, Chair. Honorable Ministers, distinguished delegates, partners, WHO Director General, and colleagues. I'll be very brief in my remarks because I think that the two presentations already made have been fairly comprehensive and have covered the facts about this outbreak and the response that the Minister of Health is leading and WHO is supporting, playing very much a role of coordinating the other partners that are taking part. I think we'd like to reiterate our appreciation of the leadership of the government and how important it has been. Tedros said earlier that the minister is not moving, but what we also have to appreciate that he is managing multiple outbreaks at the moment, including what we discussed earlier in a session, an outbreak of vaccine-derived poliovirus, a humanitarian crisis in another part of the country, and he is admirably managing to be out in the field. His Director General, it was the first person to be coordinating in Beni, locally, the response. So we have observed a strong mobilization within the ministry, within the government to lead the action while the partners were gathering their capacity. I'd also like to reiterate again our thanks to the other countries that have taken part in these two outbreaks. Not only Guinea, the Guinean experts played a unique role because they had the particular experience of being involved in a vaccination campaign. But we also received experts from other countries who have experience in surveillance and other aspects of the Ebola response, and were able to mobilize these. Thirdly, what we observed is that, in fact, in the DRC, there were experts in epidemiology. So I'm saying this because I think that within our countries, we sometimes have the expertise that we are not in contact with, that we are not able to mobilize. So it highlights the importance of these emergency operation centers or centers for disease control, which can make the link with people who have gone through field epidemiology training and are working in an NGO or working somewhere else in the country. And in the DRC, it was possible with the support of the Africa CDC to mobilize about 20 nationals, 20 Congolese experts, which I acknowledge we in WHO were not aware are there, and who are able to play a very important role in the Equateur outbreak, but also now are supporting what is happening in North Kivu. I think my colleague has already mentioned what I wanted to focus on, which is the fact that we are very much working with the neighboring countries, building on what was done in response to the Equateur outbreak, to continue to be sure that these member states are ready and they are putting in place not only the capacities to have sharpened surveillance, to have sharpened surveillance at the borders, but also to be prepared to put in place treatment centers if necessary, including mobilizing the supplies necessary, which include preventive equipment, personal protective equipment, in case this is needed. For us, this underlines the value of the joint external evaluations that you have carried out and what we have to do in supporting you to move from there to make sure that the capacities are put in place, are being built up to permanently and consistently be able to respond to outbreaks. We very much have appreciated, as I've said, the response of the national system in the country, not only the Ministry of Health, but also other sectors that have an important role to play, including the security services in the Congo. When we visited this area, as the Director General has already alluded to, we were very much struck by the fact that first it is an area of intense population movement. It's a fairly heavily populated area, so the risks locally of spread to other provinces, but also of spread to other member states, are very important. But what we think is also very important is that in the response, in the reaction, we act in line with the international health regulations, both in not isolating the country, but also in supporting them, leaving the country open to be able to receive the support. So I'd like to conclude just by saying we appreciated very much what we found as a platform for partnership with the government in this country, not only from our UN sister agencies coordinated by OCHA, but also by the bilaterals. This area has received many other visits apart from what we did with Dr. Tedros, and we are confident that progressively our member states are taking up this action in terms of building one outbreak after another on their systems, including when they are neighboring countries, and we're able to invest somewhat in working on preparedness. We appreciated very much the commitment of the health workers who were locally working, sometimes under very challenging circumstances, and most particularly the civil society, the NGOs. Our housing, the housing of our staff was provided by some nuns in a convent who were ready to convert their convent with our help into a place where our staff members could sleep because there was simply no hotel available. So it's just to underline that your staff, our staff, have to operate sometimes under very challenging circumstances in order to respond to these outbreaks. And we would like to, I'd like to end personally by underlining to our international partners that what is going to help countries is to receive the support that was implied by the insistence that countries get their capacities, preparedness evaluated independently. And they've now developed their plans, and also to see how to work together to mobilize at the highest political level, including through the African Union, the domestic allocations for this work that will help neighboring countries, in this case, and other countries in the region, to be prepared for outbreaks like this one, which we know are inevitably going to occur. I thank you very much, Chair, for giving me the opportunity.
Je vous remercie.
Thank you very much. Dr. Boeti, would the Director General like to add anything?
After almost everything has been said, so I will do after.
Je vous remercie.
Well, thank you very much for that. Thank you for this information session, which was extremely important and edifying too. Without further ado, if there are no additional comments in the room, comments from the delegates, I think we should move to the fifth point on our agenda, the program budget.
Voilà. Donc nous donnons la parole.
I believe we will now give the floor to the Director General, who will make his comments.
Thank you, Chair. I will just focus on two issues again. And I will try to avoid what has been said, because our colleague from DRC has said it very well. And in addition to that, SOSE presented well, and our RD too. One thing, though, I would like to share with you is we will be presenting the situation in Kivu area to the UN Security Council because tomorrow afternoon, because as you know, the Ebola situation in that area in Beni Mangina will be complicated by the security problem that exists there, because there is active conflict. There was engagement when we were in Beni, when we actually spent the night there. There was engagement and some civilians were killed and some were kidnapped. And 3 days ago there was another incident where the ADF forces actually attacked DRC Army, and there were casualties again. So the area is an active security and active conflict zone, and the support of the international community is important, and that's why we will be giving a briefing to the UN Security Council, and UN Security Council and through them member states can help in improving access, because we're getting some cases now in the red zones, not cases but contacts in the red zones, but so far no cases. So this is just to add one more information, and that there are things, especially security issues, that go beyond what the health sector can do. So the other machinery should also be involved in addressing the access problem. Then the second is, again, appreciating what our brother, Minister Oli Lunga and his colleagues are doing on the ground, risking their lives and helping others. This is something that we appreciate. We have been already there 4 times with my RD, CD, and whenever we go, the way he really works motivates us, inspires us. And what this shows is, as I said earlier, when the government commitment and ownership is key to success. And that's why we're stressing this fact. And I would like you to join me in giving our brother Oli Lunga a hand. He's not with us, but he's not with us, but all of us here are in spirit with him, and we give our support to him. And thank you so much for joining me in appreciating his commitment and his leadership. Thank you again. Merci beaucoup.
Je vous remercie, Monsieur le Directeur Général.
Thank you very much, Director General. We are now going to analyze the last point on our agenda for this afternoon, the high-level program budget for 2020-2021 for consultation. You can open document AFR RC 68/13. At the request of the Director General, all regional committees will consider the proposed program budget, a high-level budget for the 2020-2021 financial year. I will now give the floor to Dr. Joseph Kabore, Director for Program Management, who will be presenting this agenda item.
Excellence, Monsieur le Président.
Your Excellency, Chairperson of the Regional Committee, Honorable Ministers, WHO Director General, Regional Director, dear partners, dear colleagues, we shall now examine the program budget for 2020-2021. But first, I would like to recall that the 13th General Program of Work 2019-2023, approved by the 61st World Health Assembly, gives the strategic guidelines for the action of the organization for the next 5 years. This is an ambitious initiative that is being ably steered by Dr. Tedros, as pointed out by the Honorable Minister of Health of Zimbabwe this morning. This program budget is the first emanating from this general program of work, and the document AFR/R668/13 is the program budget for 2020-2021 Regional Committee consultation document. It seeks to give an overview on the process for developing the high-level program budget 2020-2021, including the necessary active consultation of member states in line with the strategic options of each region. This consultation needs to be carried out in all regions of the WHO, and the program budget will also take feedback from member states, after which it will be submitted to the Executive Board in January 2019 for consideration. The final version will be presented to the 72nd World Health Assembly for approval. With your permission, Chairperson, I would like to share the PowerPoint presentation with my colleague Bernard Thomas, who is beside me. And with your permission, I would like to ask him to take the floor and present the general process for preparing the program budget at global level for 2020-2021.
Thank you very much. Good afternoon, everyone. Thank you very much, Dr. Kabori. This is a team presentation, so I'll take the first two slides and provide an overview of the process and also the objectives of this presentation. But before I go to the objectives of the presentation, I would like to mention three principles that are driving the development of the program budget. Firstly, the program budget is a key instrument to implement the GPW 13. It's vision, mission, and strategic directions. You heard the DG this morning where he mentioned the very clear vision and mission and the goals of the GPW 13. This has never been clear before in the development of the program budget. Now we have a clear direction as to how we will develop the program budget and the goals that we should be trying to achieve. Secondly, we need to ensure that development of the program budget then, because of its strong country focus, will need to take into account the needs and the priorities of the countries. We have 1 year to take these adjustments forward. It is unprecedented that the GPW 13 was delivered 1 year in advance, and we should take that opportunity in order to consult and take into account the needs and priorities at the country level. Thirdly, the bold ambitions of GPW 13 calls for greater innovation, but also at the same time we need continuity of the important work that is now going on in the regions and countries, and that we need to be operational from day one, from 2020. So in this presentation, we would like to provide an overview of the process of developing the high-level program budget for 2021. We would also like to provide the initial results of the prioritization at the country level. All of you have been involved over the past 3 months in identifying priorities at the country level. And it will be an opportunity for us to present an aggregate of those results. But most importantly, the results from each of the countries is really very important to take stock of. And secondly, the third objective of the presentation is to present a high-level budget, which I will go through later on, after the presentation of Dr. Kabori on the results of the prioritization at the region, at the country level. But most importantly, we would like your guidance. We would like to listen to your advice as to the direction of the program budget. This is the first time, this is the first of the program budgets that will implement GPW 13, and this is also your program budget, and therefore we would like to receive your guidance on its development. Next slide, please. So what is different this time in this development of the program budget 2021? It will be good to draw comparisons between the process we are taking now and the process we took during the last 3 biennia to demonstrate how this process is really different this time. So firstly, unlike before, the GPW 13 has a very clear country focus, especially on delivering country impacts. This means that the process must be designed to ensure that this is realized. Secondly, the basis of prioritization is clearly the results to be achieved in countries. We are dedicating more time this time for meaningful consultations on country priorities, on the impacts to be achieved in countries, and what WHO will deliver to support the countries. Thirdly, there's more strategic consultations with the RCs this time. The last time, if you remember, you were offered an almost locked-in program budget during the RC consultations. This time, it's a little bit, it's high level. We would like to get your advice on the directions of the program budget, particularly for the region. Fourthly, we are introducing a new step in this structured process, which we call the country support plan. This we've never done before. Before, if you remember, the plans were developed at each of the levels of the organization in parallel. This time we're sequencing the process so that the work of the regions and HQ are actually geared towards delivering support at the country level. You will note later on that, especially for the EB version, that the budget will be presented along the results framework and not along programs and health topics. So if we were to deliver the impacts, the budgets and resources must be aligned to those impacts. I hand it back to Dr. Kabore to make a presentation on the results of the country level prioritization for the regional level.
Thanks so much, Thomas.
Distinguished participants, you'll certainly remember that the World Health Assembly of last May approved the 10 results presented here on the left of this slide. Under the regional consultation, the 47 member states of our region have prioritized these results from May to July. In green, you will see the countries that felt that access to essential health services was a high priority. Those that feel that it's a medium priority are in yellow, and those that feel that it is low priority are in gray. And this applies to all the 10 results, as you can see here. You will see more specifically that states emphasized certain results, such as increased access to essential health services, access to essential medicines and vaccines, and of course, public health security. In addition, the results reflect the increasing concern of member states for non-communicable diseases as one of the major public health concerns in the region. This morning, His Excellency the President Macky Sall pointed this out as well. The regional director, several ministers of health also felt the same. Building national capacity for data and innovation was seen as a high priority issue for 70% of member states as a way towards the achievement of one of the SDGs. This morning, the Minister of Chad also emphasized this point of data management and innovation. This slide presents the targets. 47 targets were proposed by the Secretariat under the 13th GPW. We invited member states to select one or more targets related to each of the 10 results of the GPW. This slide shows the 16 most frequently selected GPW targets. The deal with capacity, level of development, and ongoing commitment. And with this, we will be able to establish priorities, to monitor them, and to evaluate progress. The targets that are not on this list, but were identified by member states, will also be supported by the Secretariat. The percentages assigned to these targets, for instance, 30% reduction of the maternal mortality rate, decrease in the maternal mortality rate can be adjusted to the specific context of each country. As Dr. Tedros said this morning, the key to successful achievement of the $3 billion will be based on strong political commitment by member states, more effective partnership, and a truly transformed WHO. The Honorable Minister of Mali also passionately commented on a transformed WHO. Strengthening health systems will certainly be crucial to the achievement of universal health coverage, protection against emergency situations, and better health for healthier populations. Member states should invest in health systems as presented here that are based on persons, multi-sectoral partnerships that are effective, and strong integrated surveillance systems, as well as mobilization of sustainable funding for health. Dr. Mweti has pressed the point on the place of the health system and strengthening it in her presentation. This slide is a transition towards the program, which will be presented by Thomas. The budget overview, that is.
Budget overview. What we will be presenting to the regional committees is a high-level budget. This is quite different from what you had seen in previous biennia, where we presented the full program budget during the RCs. But that also means that the program budget was almost locked in when we presented to you during the RCs. There are two reasons for this approach. Firstly, GBW 13 gives a strong direction on shifting towards delivering results at the country level. For this to happen, the PB has to be driven first and foremost by country priorities and needs. And we can't achieve this if we locked in the budget very early on. And secondly, the high-level budget gives a direction, and the member states should then have to discuss those directions and help us shape the details so that we can make sure that we are aligned, or we are aligning to the country priorities. So the overall budget that we are proposing is $4.6878 billion. These represents a 266 million or 6% increase from the previous budget. But let me explain further this 266.3 million, because it sounds like it's very small for the bold ambitions that we have for the GPW 13. The real ask is really 469.1 million, so nearly $500 million for the program budget. But because that also represents a shift from the polio, some shift of the polio functions to the base programs, then it offsets that part, and that gives you a net increase of 266.3 million. So I will explain further in the next few slides the details of that ask, totaling to $469.1 million. So what we are trying to ask, this budget really represents a country-focused budget. So if you look at two segments of that ask, which is the increase of capacity at the country level and the polio transition budget, which is 227 million, that represents more than 75% of the increase that is being asked for this program budget. And that will all go for increasing capacity at the country level. So what are we buying from this program for this increase? What exactly we would like the investments to go, where exactly we would like the investments to go in terms of this increase? So we would like to invest in increasing capacities in countries. We can't sharpen our focus in countries and country impacts if we continue to have limited technical capacity to respond effectively and in a timely manner to member states' needs. We cannot also drop the ball on sustaining essential functions, capacities, and systems built from the polio program investments if we don't do this polio transition properly. Strong immunization and surveillance capacity and operations must continue in the countries. WHO needs to invest more to strengthening norms and standards, especially on data and innovation. This does not mean more publications in headquarters, but making sure that the norms and standards are working to support the countries to deliver impacts. The good example of this is an area of data, where the countries will need support to strengthen their capacities as well as to strengthen the data standards. We will align with the UN reform, and that's why you see a budget for that, for the support of the UN rep. That is just the initial, what we see as the initial implication of the UN reform, but there could be more implications to the budget later on. So the next slide, please. So now let's look at, in more detail, the budget for the regions. So from this, I will not read out all the numbers here, but you will see that in all regions, the budget is increasing. You will also note that for Afro, for example, the proposed budget increase will be $173 million US. The regional office remains stable, or with slight increase, about less, I think with less than 1%. The need to sustain the essential functions supported by polio is also driving the increase in the base programs. But this will mean an equivalent decrease in the polio special program budget. So you will see here, as pointed out by the DG this morning, for headquarters, you will see a flat budget for headquarters, while an increase of the budget in the regions and especially at the country level. So the next slide, please. Now, let us zero in further on the increases for 2021. So you will see that the increases for the budget for technical capacity in country office is very significant. This is in line with the direction of the GPW 13 for increasing capacity in countries and driving impacts at the country level. You will see, in comparison with 18-19, that there is a 317 million increase proposed for 2021. This is about a significant increase, but you will also note that compared to 2014-2015, if you compare the increases that we are trying to make for 2021, that is a big boost, which is about increasing the budget at the country level for technical, for increasing technical capacity by 60% over the last 3 biennia. So that is a very significant direction being proposed by the program budget. So the next slide, please. So if you look at the, let's focus on the budget by level of the organization. So if you look at this slide, you will see a very big difference in the share, the allocation share of the budget for the country offices. In the past, you would have seen a 1% or even less than 1% increase at the country level in the last 3 biennia, if you remember. This time, you are seeing a 5% increase for the allocation of the budget for the country offices. A relatively stable budget in regional offices, and a slight decrease at headquarters for their allocation of the total budget. So this is the direction, is a very clear direction that is being proposed for the program budget and for your consideration. So the next slide, please. So for the next steps, the budget is not only the manifestation of the commitment for driving country impacts and accounting for the country needs and priorities. The DG and the RDs have decided on a new planning process that makes sure that the country needs and priorities are actually the starting point of the development of the program budget and the planning. So you would have been engaged with our country offices and our regional offices on the identification of the priorities at the country level. That, we hope, is the starting point of the planning and the development of the program budget. So in the next 2 months, we will all go through a planning of country support. As I mentioned earlier, this has been introduced as part of the planning process in order to make sure that the planning of the entire organization is geared towards achieving country impacts. This is just to show you the end-to-end process of that planning. But the real emphasis here is really that we are starting from your priorities at the country level, and we are pursuing that further by doing a sequential planning that starts at the country level, and regions in HQ plans will be geared towards supporting those. This next slide, please. So in terms of next steps, so we are here to listen to your guidance on the from the regional committee for the development of the next phase of this program budget, which is the EB version. In the EB version, we expect to present a full program budget with a much more detailed information on the programming and on the budget. So that will be, the inputs to that will be the consultations from the regional committees and the results of the country support planning that we will do in the next 2 months. So there will be mission briefings and further briefings before the executive board as we develop the version for the consideration of the executive board in 2019 January. And we expect that there will be further deliberations during that time, and we will be presenting the program budget for WHA endorsement or approval for in May 2020. So that is the process that we're taking in order to develop the program budget. It's sequence, and it's all about delivering the country impacts.
Monsieur le Président, sur ce...
Chairperson, on this note, document AFR/68/13 is submitted to the Regional Committee for consideration. Thank you.
Je vous remercie.
Thank you, Dr. Kabore, for that presentation. For comments and observations, I don't know if the honorable delegates are ready and fresh to give the comments. I see Central African Republic is indicating that they wish to comment. So we shall open debate then and give the floor to CAR for its comments. Thank you, Chairperson. I would like to congratulate the Director General and the Regional Director for this strategic exercise, which is a great source of inspiration for us. I simply would like to confess here, I don't know the experience of other countries, but my representative is here. It seems to me that this work was done at technical level and sent off. When I look at the priorities that were selected, I don't get the impression that I personally was involved. I don't know the experience of colleagues from other countries. However, the lesson to draw from this is to ensure that the minister has really and truly responded with his signature. I don't know if these priorities were communicated with my signature. That said, the sum does amount to things that can correspond to my priorities. But when I saw the list of countries and the priorities chosen, I was I was taken aback, because but at the end of the day, I would probably have approved all the priorities. However, we need to draw a lesson from that. I simply would like to be sure about how human resources have been taken on board in the operational aspect, because it's not very clear in the document how countries will be supported. I imagine that human resources are implicit here, but we have all raised this problem of human resources here, and so I felt that it's something that should show clearly in the implementation modalities, so that we would also know what it costs. Thank you. Thank you. Malawi has the floor, to be followed by Liberia.
Thank you very much, Mr. President, for giving Malawi the floor. I need to commend the Secretariat for coming up with this budget. As you say, this is a high-level budget. I just had one observation, and I need to confess that last time I did statistics is a while back, and I understand this is being referred to as a $3 billion goal. And what I did is just look at the strategic priorities, where the first talking about 1 billion or more people benefiting from UHC. The second is 1 billion people better protected from health emergencies. And the last one is 1 billion people enjoying better health and well-being. Are we saying these are 3 different groups of people, or there could be an overlap? And if so, was this considered in the calculations of the budget? Because talking about the Malawi experience, we have social protection interventions where we give people, for example, social cash transfer, fertilizer subsidy, and so on and so forth. And there's a big overlap in this population. So I just want to find out if this consideration was taken into account when doing the calculations. Thank you.
Nous donnons la parole au Liberia.
Liberia has the floor, to be followed by Kenya.
Mr. President, it's off. Okay, thank you. It just went off. Thanks for allowing Liberia to speak on this major issue. I want to express my thanks and appreciation to the Budget Committee for coming up with this budget that, as it has been presented, seems to be a bottom-up approach. why it
Technicien, s'il vous plaît. On attend le technicien derrière là.
We're waiting for the technician.
Okay, thank you. Again, I want to say thank you to the committee for this approach, which seems to be a bottom-up. But my concern is more towards its implementation. How well have we given this a thought? Because if it has to be country-driven, then of course, countries have to be in the driver's seat. It's not a bottom-up approach where countries' full participation is not in the process. And I think if we want to take the approach that has been presented here, that is excellent. But I'm concerned because there have been many programs that have been put forth from the country level, but when it comes to implementation, it is a different thing. The countries are not in the driver's seat. So it is my hope and prayer that this budget, if implemented, the country's priority should be key, but they should be in the driver's seat in order to make sure that the priorities are achieved. Thank you.
Je vous remercie. Nous donnons.
Thank you. Kenya has the floor, to be followed by Tanzania, Comoros, Zimbabwe, and Angola.
Chairman, for the opportunity to provide an input. And as Kenya would like to thank the Secretariat for preparing the program budget for the biennium 2020-2021, which has just been presented to us. And we do appreciate the work that has gone into this document. And just like colleagues from Liberia, do appreciate the fact that it was a bottoms-up approach, and that included consultations with the ministries of health as far as the country offices in order to identify priority areas. We also take note of the fact that the proposed areas are in line with the GPW that was adopted in May 2018, and therefore provides a great opportunity to translate the vision of that GPW into plans and implementation so that we can realize the $3 billion. And therefore bringing us together closer towards a world that is safe. And the delegation also welcomes the budget shifts between the program budget for the biennium 2018-2020 and the proposed program budget for 2020-2021. Would like to specifically emphasize the fact that the investments that are proposed in advocacy, in political mobilization, and also in diplomacy, which are significant, should be continued, while at the same time we should ensure that these investments are effective and have real value for money. And furthermore, would like to propose that these investments, which will go towards resource mobilization, should be the impact of these investments should be quantifiable and that it should also be reported transparently in line with WHO's desire for efficient and responsive operations. We also take note of the Secretariat's aim to secure funds upfront so that there is certainty in the program viability, and we support the efforts of WHO to source more funding for the non-earmarked funding, with the objective that these are also aligned to the 3 billion. We'd like to commit as Kenya that we'll continue engaging in the entire process, leading to its final approval at the WHO next year, and continue also to encourage WHO and the regional director to consult with countries to ensure that this budget is continuing to be aligned to the aspirations as it's in the GPW. I thank you, Mr. Chairman.
Je vous remercie. Nous donnons la parole.
Thank you. Tanzania has the floor. Comoros will follow.
Thank you very much, Mr. Chairman. Tanzania takes note and commends the Secretariat for the ongoing consultation process of developing the program budget for 2020-2021, where countries are being consulted to provide further inputs before finalization of this important document. Tanzania conducted in-country consultation with the WHO and the other stakeholders for more inputs. We appreciate that country priorities have been reflected in the document, especially the support on strengthening health systems as a key driver for achieving universal health coverage. In view of this, we would like to emphasize the need for WHO to continue supporting countries in addressing the human resources challenges in healthcare, while also addressing the availability of health commodities. Having skilled health providers is critical to ensure quality service and the correct information provided to all, while resources contribute in having a resilient health system. We support the need to address risk factors related to both communicable and non-communicable diseases with an integrated approach to health promotion and prevention, where individuals, families, and communities are engaged to protect their health. Mr. Chairperson, we have noted with appreciation the inclusion for the first time a budget line for humanitarian response, plans, and appeal. This is a critical step of commitment from WHO in tackling this very challenging area, where emergencies are unpredictable and our region is mostly affected, and it requires initial rapid support to contain these emergencies. Mr. Chairperson, while the document has reflected priority areas, including the need to invest more on data and monitoring, it is our expectation that the already agreed global targets and indicators, including the ones for Sustainable Development Goals, will be used to monitor progress, as we don't wish to add further burden to countries, especially to service providers, in collecting new information and compare the quality of services provided. More clarity will be required in the final document on all the proposed targets in Annex 5 to this document, how they'll be collected at country level, as some of the proposed targets are not very clear on what will be the denominator to measure progress. Lastly, we support the next step of developing specific country support plans based on country needs and priorities to ensure the support we get from WHO through the program budget 2020 to 2021 be relevant to our countries. We are looking forward to further engagement in this process at country level, as well as during the Executive Board meeting in January 2019 and at the World Health Assembly in May 2019. Thank you very much, Mr. Chairman.
Je vous remercie. Nous donnons la parole.
Thank you. Comoros has the floor, to be followed by Zimbabwe.
Merci, Monsieur le
Thank you, Chairperson. Comoros would like to congratulate the Secretariat for presenting the 2020-2021 program budget. Chairperson, distinguished delegates, this high-level program budget for 2020-2021 based on the three strategic priorities of the GPW 13, which are universal health coverage, health emergencies, and well-being of the populations, take into account, as far as Comoros is concerned, all our concerns with respect to health and well-being as presented in our health policy and our sustainable development and growth strategy. Chairperson, the program budget 2020-21 is in line with the Global Agenda 2030 and can no doubt contribute to promoting health, preserving global security, and serving vulnerable populations. Comoros is happy with the policy of the regional director to emphasize the countries and invites our organization to strengthen its authority to coordinate health in countries so that it can fully play its leadership role in the health sector in member states. The government of Comoros that I represent here takes note of this document. Thank you. Thank you. Zimbabwe has the floor, to be followed by Angola.
Welcomes and notes the program budget 2020 to 2021, and we believe it is much more innovative than in the past, and it is aligned to country needs as well as being results driven. And we do welcome the fact that this budget will be focusing on priorities, and we quite like the slogan of the triple billion. And this is, of course, against the categories that used to be done in the past. Now we don't do categories, we're focusing on priorities. And I think the priorities that are listed in the document are not cast in stone for individual countries. We can, when we engage with the WHO, then put up our own country priorities as we see them fit at that time. The budget of 4.687 billion is segmented into assessed contributions. It is also segmented into voluntary contributions and into contributions that are totally earmarked, what they call specified funding. We as Zimbabwe still appeal for this last component to be availed as flexible funding. Member states have demonstrated, and as past chair of the regional committee, we've seen that member states have demonstrated accountability and have been very conscious of the recommendations from the last audit report, and great improvements have been noted. WHO has placed controlled mechanisms that have increased accountability, and today the Africa region has demonstrated through key performance indicators their seriousness about compliance, accountability, and improved governance. So overall, Zimbabwe is in full support of the PB 2020 to 2021. Thank you, Chair.
Je vous remercie. Nous donnons la parole à...
Thank you very much. And now Angola has the floor, followed by Guinea-Bissau.
Muito obrigado.
Thank you very much, Chairman, for the opportunity that you give me to say a few words. I would like to congratulate the working group that prepared this document on the subject of the program budget 2020-2021. I think that this 13th general work program is to be lauded, together with its vision, the vision behind it. We're working on analyzing the priorities identified, and once we have finished this prioritizing task together with WHO at a national level, we will make the results available to all and sundry. We believe this to be a very important matter when it comes to UHC, in terms also of health emergencies, because we need to make sure that our populations become healthier. So we take good note of this document, and we will work with the WHO to implement it. Thank you.
Je vous remercie. Nous donnons la parole à la...
Thank you very much, Guinea-Bissau. Thank you very much, Chair. Like the colleagues before me, I too would like to commend the working group responsible for preparing this program budget, because the countries were in fact involved. Countries participated in the definition of the priorities laid down. There is an issue I'd like to raise, if I may. To be honest, I see that countries have different needs. There are countries that have fewer needs, as it were, because they have already taken many steps in comparison with other countries. What I would like to know is the following. Although countries have already identified their priorities, I wonder if the WHO, when distributing this budget, isn't going to take into account countries that have greater requirements, greater needs. In other words, how are you going to distribute the funds in the budget we currently have before us? We know that the economic levels of our countries are different. Some states very often find they don't have the economic conditions required in order to meet their obligations they have vis-à-vis their citizens. When this budget is distributed, is the WHO going to take this into account with a view to ensuring that the target defined of the 3 billion people, are we going to be able to reach these 3 billion people so that the citizens of our countries will really be able to receive the support they require? Because we have very clear targets defined. What we don't want is there to be an imbalance in access to health. In this instance, we may find that there are countries where citizens benefit more than in other countries, and countries that don't have necessary domestic resources may have difficulties if they don't receive enough resources from the WHO. Then they won't be able to meet the targets proposed. They may partially meet the targets, but not the full target. This, of course, because, as I was saying, of the differences among the different countries. This is my concern. Thank you.
Je vous remercie. Est-ce que le docteur...
Thank you very much. Dr. Caboret, would you like to say a few words in response?
Monsieur le Président, très brièvement, vu le temps.
Very quickly, Chair, given the time constraints, let me just tell the Minister of Central African Republic that we will look into how to make this a dynamic procedure over time. So we will have to look into how improve the exercise working with countries. In the case of Liberia, when it comes to implementation, the second stage, as Thomas indicated in the presentation, will allow for country support plans to be drawn up, which will indicate the expected needs. needs of the WHO, regional level, world level. So the 3 levels of the WHO will define the support that will be adapted to the needs of the different countries. And this also tallies with the question by the Minister from Guinea-Bissau. Thank you.
Je vous remercie, Dr. Kabore.
Thank you very much, Dr. Kabore.
Collègues, mesdames.
Dear colleagues, ladies and gentlemen, dear delegates, perhaps the Secretariat can take into account all of the suggestions and comments, using this as a guide for the development of the proposed Programme Budget 2020-2021, and perhaps the Regional Committee can take note of this document, the document entitled High-Level Programme Budget for 2020-2021, AFRRC 6813. I think we can now give the floor to Philippe Mavungu, Council Member for the World Federation of Societies of Anesthesiologists, who will be presenting a statement. Dr. Mavungu, is he in the room?
Monsieur le directeur général, Madame la directrice régionale, Excellences, Mesdames, Messieurs les ministres, Mesdames, Messieurs, la WFSA.
This association represents anesthesiologists who seek to contribute to the SDGs. Acted closely with the WHO to strengthen surgical needs, and it is supported by Zambia and other African countries during the World Health Assembly. We feel that every year 4 times more persons die following an operation than HIV and malaria and all kinds. And yet, surgical intervention that is sure.
Et lentement pour l'interprétation.
Exactement.
Can you take it more slowly? But surgical intervention that is sure depends on sure anesthesia. It is complex and potentially dangerous. And even though a team approach is preferred, optimal surgical care depends on the quality of anesthesia that is conducted by an anesthesiologist. The global survey by the association, by the federation, showed that Africa has a density of 0.44 per 1,000 inhabitants, which is lower than the recommended 5 per 1,000. The WFSA is therefore involved in the training of doctors and other service providers in Africa and other regions, alongside the evaluation of capacity for national planning of surgical, obstetrical, and anesthetic needs. Anesthesia covers a lot of the work of the WHO, and we are pleading for increased involvement in the care of maternal and neonatal care, and the need to ensure the availability of essential medicines and equipment. We therefore wish to urge the Regional Committee for Africa to give utmost consideration to Resolution WHA 6815, so that together we can put an end to the neglect of surgical patients. Thank you for your attention.
Je vous remercie. Avant de conclure notre...
Thank you. Before we finish our session for today, does the Secretariat have any administrative announcements?
Thank you, Chair. Allows the Secretariat to do some admin announcements. At the end of this session, a coffee break is served in front of the entrance hall for 30 minutes. Buses to the hotel will be available for those not participating in the dinner. For those participating in the dinner, kindly proceed directly to the room flamboyant. I would like also to remind for the program of work tomorrow morning, 2 side events are scheduled. Sorry. 2 side events are scheduled, both at 7:30 to 8:45. The first one is Garvey Aliens, doing business differently towards UHC. This side event will take place in the room BC12. Then there is a second side event, which is a private side event on reproduction of preventable maternal disease. This side event will take place in B05. Thank you very much. Oh, sorry, I forgot to say that some refreshments will be served during during both side events, so you are welcome to enjoy them. Thank you.
Je vous remercie.
Thank you. We have come to the end of today's session. I would have the honor of joining the regional director to invite you to the dinner this evening, and we shall reconvene tomorrow morning at 9 o'clock. Thank you.